Good morning, everybody. Hello, nice to see you. Thank you all for coming, and hello, everybody online. We're joined by quite a few interested parties online as well, so very warm welcome to everybody. My name's Elaine Bedell. I'm the Chief Executive of SouthBank Centre, and we're very pleased to welcome you here today for this National Academy for Social Prescribing Show. And we are the partners with NASP on this event. I want to begin by showing you a clip of some of the work that we've been doing here at SouthBank Centre over the last year. Very difficult to sum up the range of stuff that we do here across our artistic program and our creative learning program in one short clip, but you've got a bit of a flavour there of everything that we'll be doing. And it's very fitting that we're coming together to discuss the power of social prescribing to impact lives here on the site of the Festival of Britain. The Royal Festival Hall is the remaining iconic building from that Festival of Britain from 1951, which was a project to bring people together after war as a tonic for the nation. And as we emerge from another era-defining crisis, the power of arts and culture to give people expression, connectivity, and empathy have rarely been needed more. Creative health, one of the main pillars of social prescribing, is a strategic priority for the SouthBank Centre, and we've boosted our resources to support this important agenda in recent months. Our Arts and Wellbeing programme continues to focus on reducing social isolation and loneliness by building connections and communities around our programme. And we'll continue to explore how we can also create communities online for people who find it difficult to leave their homes or travel. Our lockdown project, Art by Post, was an important programme reaching over 4,500 people across the UK, including the socially isolated and those who didn't have access to digital arts and culture. We're hoping to expand this programme over the next year with the support of NASP, and we'll continue to support people who face chronic long-term physical or mental health problems. Since we reopened our buildings, we've re-established the regular sessions with our community groups. We work with Streetwise Opera, Women for Refugee Women, Grounded Ecotherapy, and Breathe Sing. We've also relaunched our monthly social dances to be more inclusive and representative of more dance styles and formats in order to welcome more people onto our site. Those take place on the ballroom floor of the Royal Festival Hall. And we're going to be launching a new project this year, a wellbeing choir and singing, we hope, across the nation, starting from within schools and building to establishing a wellbeing choir here at SouthBank Centre. We're really pleased that NASP have moved onto our site. We house NASP here, they have their offices with us, and that has cemented our partnership together. We'll be working ever more closely together to spread the impact of social prescribing and creative health throughout the sectors and the country. So welcome, I hope you enjoy today's discussions and events. And I'm now going to hand over to Kamal, who's your host for today, and is going to be taking you through our various discussions and panels. Kamal. Thank you very much. Look forward to seeing you soon.
Thank you very much, Elaine. Thank you very much, Elaine. Good morning. Good morning. Not bad. I'm feeling like the Weetabix section here. I like it. I'm going to go say, good morning. Good morning. Not bad. Good morning. Good morning. Good morning. Good morning. Oh, I like it. Welcome everybody to the first ever Social Prescribing Show. It's beautiful to have you here. My name's Kamal Ellis Hyman. I'll be your host for today, taking you through the day. We've got an amazing day ahead. It also launches Social Prescribing Week, which is going to be an amazing week where we're going to be able to hear about the impact of social prescribing. I was going to say nationally, but even internationally. So a really great week ahead, and I'm looking forward to today. We've got panels, we've got a special tour for you later on, and even a few surprises throughout the day. It's going to be a wonderful day. I have got a little test for you before we start, though, so it's really simple. When I say clap your hands, you've got to raise your hands. When I say raise your hands, you've got to clap your hands, okay? I like it. Some of you are like, yeah, some of you are like, huh? So clap your hands. Not bad, not bad. When I say clap your hands, you raise your hands. When I say raise your hands, you clap your hands. I like some of you like, why don't you just say that in the first place? Clap your hands. Clap your hands. Raise your hands. Raise your hands. Raise your hands. Clap your hands. Not bad at all. Not bad at all. By a show of hands, how many of you have Twitter? Perfect. That's going to be useful today. Instagram? LinkedIn? How many of you have been forced by a child, a niece, a nephew to get TikTok? Beautiful. Well, we have a hashtag today. It is hashtag Social Prescribing Show. Throughout the day, if you could tweet your thoughts, let us know how you found the event. If you've taken any photos, post them up and use the hashtag. We'd like to get a buzz going on online. And speaking of online, also, I'd like to welcome everybody joining us from Zoom. It's good to see you. And of course, throughout the day, when we get our guests on, if we could keep the energy in the room with rounds of applauses, making everyone feel welcome. And what's really special about today is rather than just being a conference where you're sat watching and listening, we want you to get involved. So at the front, you'll see 2 microphone stands. This is where you're going to come up and just sing your favorite song at a random point throughout the day. At the end of every session, there's going to be an opportunity to ask questions to the panel. So if you have a question, come on up to the front, stand by a microphone, and you'll be able to ask your question to the panel live in person. There are photographs being taken today. If you're uncomfortable with that, if you could let a member of the NASP team know, so we won't include you in any photographs. Equally, if you have an agent and you need to be paid for the photographs, let the NASP team know. I won't be dealing with that myself. And finally, on each of your seats, you will see some postcards. Now, these postcards are here because, as I said, today's about not just listening and learning, but also interacting, hearing your solutions too. So these are what we call provocation cards. At the end of each of the panels, we'd love to hear from you what challenges you believe there are, but also what solutions you'd like to suggest. And at the end, in the foyer, there's going to be a pin board where you can put your thoughts, your challenges, your solutions up, and we can read everybody's ideas and have a collaborative approach to the day. So it's going to be an amazing day. Thank you very much for braving the tube and getting here today. The tube let me down, but Uber was there for me, and I'm glad to see you've all made it too. Now, finally, I get to introduce the CEO of NASP, who's going to come and give our opening keynote. So if you could, it's our first opportunity to see how good you are at this introduction thing, right? So let's start with we're going to go from 1 to 10. So give me like your 1 out of 10 clap. You know, 1 out of 10. A 1 out of 10 is like, it's how I clap after an Arsenal game against Man United, where we really needed 3 points and Man United beat us. So that kind of 1. Nice, nice. Give me a 3. What's a 3 to you? Nice. That's that sarcastic, you know, somebody, you're about to reverse park and they slide in it. Nice. Give me a 5. What's your 5? What's your halfway? Fair, fair. All right, keep going. Give me a 6, a 7, an 8, A 9? A 10? Yes! Beautiful. Ladies and gentlemen, please welcome to the stage the CEO of NAS, Mr. James Sanderson.
Oh my goodness! I think that was a bit too much. Actually, I think I'd have been happy at 5. Well done, everybody. That was fantastic. Good morning. It's brilliant to be here this morning to see so many fantastic people in person and so many people that I know are so passionate about social prescribing and have devoted their life and careers to making this work. And it's phenomenal to see so many people that have really made social prescribing happen right across the country. And to those of you online as well, thank you very much for joining. I know, looking at the list of delegates, that everybody does fantastic work in this area. And I wanted to start off by just saying an amazing thank you to you all, because what we've achieved over the last couple of years in bringing social prescribing into the fore, in enabling it to be part of the mainstream healthcare system, is fantastic. And that is down to all of you and the many, many people that are working every day, day in, day out, to change lives through social prescribing. I just wanted to thank Elaine for her fantastic words. It's fantastic to be here, an organisation as NASP in the SouthBank Centre, in partnership with the organisation that's doing so much work. And it was great to hear Elaine's list of fantastic programmes that the SouthBank have got coming up over the course of the next year. So why social prescribing then? Why is it important? You know, why do I think it's important? Well, Professor Sir Muir Gray says that it's easy to be healthy and well. You just have to be born in the right postcode area, you have to have the right amount of money, and you have to have the right genetics. That's it. You know, if we fail at that, then, you know, there might be a problem. But if we can all achieve that, then we're going to be fine. So that's easy, isn't it? We also talk about lifestyle, don't we, and behaviour choices. We talk about ill health and we say, well, people haven't adopted the right lifestyle, they haven't adopted the right behaviours. But actually, isn't that wrong? Isn't it wrong to think that in this country, people that are born in the poorest areas will develop a long-term condition 10 to 15 years earlier than those in the most affluent areas? And they may well die 10 to 15 years earlier as well. Now, that's about postcode. It's about level of connection to society. It's about money, and it's possibly about genetics. But we know those factors are hugely detrimental to our health. We know that the social determinants of health are much more powerful than the biomedical approach that keeps us well. Biomedicine's fantastic. You know, we all need drugs. Drugs are fantastic. And we know that with the demonstration of the COVID-19 vaccine. We've seen the massive transformation that vaccination has made across society. So biomedicine's still going to play a role. And if you look at what's happened, the advancements over the last 100 years in medicine, it's been amazing. You know, it was less than 100 years ago that we discovered penicillin. That was 1924. And you look at what's happened over the scope of the last 100 years with advancements in medical practice, you know, the ability to x-ray somebody, the ability to do an MRI scan, the ability to transplant hearts and lungs in human beings is phenomenal. And we know that those things are really important for health, not just in this country, but global health. However, because of those social determinants, because of the issues that we have in society, we know that biomedicine isn't going to be the only answer. We know that it has limitations. We've seen through the Chief Pharmaceutical Officer's recent review in over-medicalisation that 1 in 5 people over the age of 65 that are in hospital not because of the condition they're living with, but because of the medications that they're taking. We also see that pharmaceuticals are damaging to the environment. We see that they create harm to the biodiversity of the planet. And actually, we know that there are limitations. We see issues with addiction to opiates, to painkillers. We've seen the National Institute for Health and Clinical Excellence, NICE, recently say that actually exercise can be more beneficial to people than taking opiates and taking other forms of painkillers. We also know that there are issues in society with things like antimicrobial resistance that's creating the resilience of viruses, the resilience of bacteria, and really reducing the benefit of biomedicine. And we know that 1 in 5 people going to see their GP today will be turning up to their GP with a social need, not a medical need. They'll have an issue with housing, with relationships, with debt, with social isolation and loneliness. We also know, when you look at the NHS, that 40% of people say they lack the skills, knowledge and confidence to manage their long-term conditions. 40% of people also say that they're not involved in their care as much as they would like to be. And 40% of people say that they do not have the ability to understand information that they're provided with by the NHS. So actually, if this is the environment that we've got, if we've got a society that has so much inequality built into it, if we've got a system where, whilst biomedicine plays an amazing role, we've also got issues with its limitations, this is why we need social prescribing. And I think that case is no stronger than it's ever been. I think social prescribing creates a revolution in health, not just in health and well-being for people living in this country, but actually it creates a global revolution in health. I think we've got to embrace this now, because if you look at the global health challenges that we have as a society, we've got to find different ways of approaching that. And actually, a downstream crisis management health system is not going to work. It's not going to work for all of us. It's not going to work for people in our families. It's not going to work for our friends. We need to be properly investing in prevention. We need to properly invest in upstream support. So social prescribing then, what is it? Well, we all know it's about connection. It's about connection to community. It's about connection to things in the community that are going to help maintain our health and well-being. And I talk about 4 zones of social prescribing. So things in the arts and culture space, things about connecting to the natural environment, the opportunity of sports and exercise, and then advice and information and guidance. You know, these 4 zones hold all the keys to maintaining health and well-being. And we've developed at NASP an ecosystem of social prescribing. And if I can have the next slide up, this demonstrates just how social prescribing can operate across a whole society model. So at the core, we have social prescribing link workers who do amazing work every day, working intensively with those people who may need support, development of a plan, the opportunity of building their agency, building their skills, knowledge and confidence, and making connections to groups in an authentic and involved way. We also know that there's lots of people operating in communities that support those people who don't need that level of intensity, that may just need connecting, that may just need a bit of signposting, that may just need a helping hand to connect to their communities. And we know that there are people out there as well that actually could make those connections themselves, that already have that enablement to make those connections. They may have the means, they may have the connections already, but they don't necessarily know that those things are going to be good for them, that taking more exercise, that joining a community choir, that joining a walking football group, that getting out in nature is going to be good for them. So what we want to do is we want to really take this model out to society. We want to say, look, this is how we can transform health and well-being. This is how, as a nation, we can create this revolution in health by embracing this whole ecosystem, by supporting people effectively at all levels in society. And we need to, within that core level, we need to get behind those link workers. We need to ensure that we've got link workers operating in every primary care network across the whole of the country. And the 1,800 link workers that are already in place doing a phenomenal job, but we need more. We need to build this workforce that is going to really transform the way in which primary care works and transforms lives for people. And NASP is doing its own bit as well. And this next slide just shows you a little bit about what, as an organisation, we're doing. We've really embraced the opportunities of working with partners. And I wanted to thank all of our partners across the whole country for their support. That's partners that are working on the ground in local communities through our Thriving Communities programme. We've got 36 programmes across the country that have engaged over 10,000 people, working across all the zones of social prescribing, coming together with new and innovative collaborations. We've got an innovation programme where we're accelerating innovation at a national level, working with partners that are really investing in social prescribing to ensure that we can embed really positive activities in local communities. And we've also working with the World Health Innovation Summit, with the UN GSII and the World Health Organization on the delivery of a global social prescribing alliance. And I know that there's a number of people watching internationally now that are already part of that global movement. And it's fantastic to see that we've got a discussion later on the global social prescribing that's really taking shape across the whole world. So this is just a flavour of why social prescribing is important. For me, as I say, I think it represents a revolution in health and well-being. And I'm grateful to everybody for your support. And I'm really looking forward to working with you over the coming year, because I think we can really, really push this agenda much, much further and really transform lives. Thank you.
Good morning, everybody. I'm Amy Vaughan. I'm Director of Change Programmes at Arts Council England, and I'm very, very happy to be here with you all today. I am representing our Chief Executive, Darren Henley. Yes, oh good, they did put my name there as well. I had a horrible feeling I'd come out and I would be Darren Henley, and I couldn't possibly do that. My mum will be so proud I'm finally on stage at the SouthBank. I'm representing Darren today, but I am here in my new role at the Arts Council, where I'm taking on the health and wellbeing agenda. It's an absolutely fantastic role to be stepping into. I've been at the Arts Council for 9 years, been working mainly regionally and in place, and one of the things that really excites me about this area of work particularly is the opportunity to work with partners in other agencies, because that's always been what has been the most exciting thing about working in a regional team at the Arts Council. So to be able to work really strategically with partners across sport, nature, and with NASP and the NHS is just a real honour for me. So really pleased to be here with you today, and looking forward to talking at a panel later on. But enough from me. I wanted you to hear from the horse's mouth quite how important the health agenda is to the Arts Council as we move forward with our new Let's Create strategy. So in between select committees this week, I pinned down our CEO and asked him to record some words for you today. So if we could play the video, please.
Creating happier lives. Those are the 3 words that get me out of bed every morning. It's why we do the job we do at Arts Council England. It's what drives the people, the boards, the businesses and the volunteers that work in our sector to be the best they can be. Let's Create, our 10-year strategy for creativity and culture in England, focuses on 3 outcomes. Creative people, giving everyone the chance to develop and express their creativity throughout their life. Cultural communities, villages, towns and cities thriving through collaborating around culture. And having a creative and cultural country, England's cultural sector being innovative, collaborative and international. At the Arts Council, we believe that people's health and well-being runs through the heart of this strategy. We know that the opportunity to express creativity has proven benefits on people's health and happiness. But it's not just our new strategy that values the strengths of creativity for helping us to lead healthier lives. Arts Council England has a long history of partnering culture with health and well-being. As far back as 2008, we published a joint compact with NHS England to emphasise the value that culture and creativity can bring to the health of communities across the country. An early focus for us in this area was around creative ageing. Between 2013 and 2016, Arts Council England and the Bearing Foundation collaborated to deliver arts in care homes. That was followed by Celebrating Age, an even more ambitious collaboration, which saw projects up and down the country use creativity to connect some of our most vulnerable and isolated communities to each other through participation in cultural activities. In 2017, we were a partner to the publication of Creative Health, the landmark report of the all-party parliamentary group on the arts, health and well-being. This continues to serve as a strong rallying point for policymakers and practitioners at the intersection of arts and health. And 2021 saw the delivery of one of the report's key recommendations, the creation of a new National Centre for Creative Health. We've worked with a wide range of key partners across the health and care landscape, including public bodies such as the Department for Health and Social Care, NHS England and Public Health England, as well as national charities such as Age UK, Mind and Scope. The coronavirus pandemic has highlighted the role that creativity can play in the well-being of people's lives and the communities they live in. Creativity shone through the darkest times in the pandemic, stimulating and entertaining people and offering some respite from loneliness and isolation, helping people to manage clinical mental health conditions, as well as promoting positive mental health for the wider community. From the start of the pandemic, we witnessed many inspiring examples of this. One of the first such instances, and perhaps the most iconic, was the very moving sight of Italian families singing from their balconies across deserted streets. Here in the UK, an impromptu programme of garden gigs emerged in Sheffield, with neighbours performing to each other from their own backyards. We also saw high engagement with TV-led mass creative projects like Grace and Perry's Art Club on Channel 4, with 1.3 million viewers a week, and Gareth Malone's Great British Home Chorus, an internet choir which saw more than 100,000 viewers sign up in the first week alone. We saw book clubs, singing groups and drawing classes use creativity to stay connected, from using video conferencing platforms online to embracing analogue communication by sharing tapes, letters and books by post. The use of windows and doors as an impromptu gallery space was so widely adopted that London's Victoria and Albert Museum documented the moment for posterity. And so to social prescribing. In our work on the Thriving Communities Fund, we've seen really exciting developments in this space. Co-funded by Arts Council England, the National Academy for Social Prescribing, Historic England and Natural England, and involving wider partners, NHS England, DCMS, Sport England, NHS Charities Together, and the Money and Pensions Service. The initiative is supporting 36 projects, including 200 more organisations across culture, heritage, nature, sport and beyond. They're developing and delivering social prescribing activities addressing those communities most heavily impacted by the pandemic, including those living with long-term health disparities. The programme aims to reach more than 8,000 people over 12 months. We know firsthand from these brilliant projects how profound and impactful social prescribing can be on individuals and their communities. We know that this can make people's lives happier and healthier. So as we take our strategy forward, we're committed to continuing to work in partnership with our colleagues across sport, nature and heritage, and with colleagues at the Department for Health and Social Care, NHS England and the new integrated care systems. Alongside them, we'll work to position social prescribing as a critical tool in the healthcare armoury of this country. And in doing so, we'll move closer to our shared goal of creating a healthier, happier society.
So I won't keep you any longer. I hope Darren has said it all about our commitment to this, and I really look forward to working with you all, and come and say hello during the day. Thanks very much.
Morning, morning. Massive thank you to Elaine Bedell, James Sanderson, and of course, Darren Henley on screen and Amy Vaughan. I feel like we're getting off to a good start. I've got to test you though. Clap your hands. I'm not even angry, I'm just disappointed. Raise your hands. Raise your hands. Raise your hands. Clap your hands. Not bad at all. Not bad at all. So we're about to get into our first panel of the day. As I mentioned, at the end there will be an opportunity for Q&A. Your microphones are up at the front. If you are online, hello Zoom, type your questions in. We'll do our best to keep up with the questions and make sure your questions are asked as well. Quick test for the audience. What's the hashtag of today? All right, you've been listening. I like it. A+. Absolutely. We are keeping an eye on Twitter, so please continue to send your tweets through. This first session is all about communicating the power of people's stories. I don't know about you, but when it comes to trying to understand the power of a project, of a movement, once I hear how it affects the individual person, it makes a huge difference to me. I'm way more invested and way more passionate about it, because at the end of the day, this is all about people. So our first panel is going to be chaired by, actually, on a side note, it's going to be chaired by Dr. Radha Modgil. And she's actually, the way I first found out about social prescribing was through Dr. Radha. So a wonderful human being, generally speaking. So if we could put your hands together for the wonderful Dr. Radha.
Wow, what an introduction. I hope I live up to that. It's so lovely to be here. It's so nice to see all your faces and to do something in person and face to face. I'm Dr. Radha Modgill. I'm the Ambassador Lead for National Academy for Social Prescribing. It's a real honour to be part of the Academy. It's a real honour to be part of this incredible community of people like you who are doing fantastic work across the country to support people and enable people to change their stories and their lives. And I'm really delighted, actually, to be here with two fantastic panellists I'm going to introduce in a second, because this panel is all about communicating the power of people's stories. And I'm also a GP, so I hear a lot of people's stories in my practice. I also do media and broadcasting work around wellbeing and particularly mental health. And in that role, I hear a lot of people's stories. I hear a lot of people who are lonely, who feel isolated, and who don't really know where to go. And so I know the power of connecting people through their stories and the power that actually people find within themselves when they hear about someone else's story being similar or having similar elements to their own. So I'm really thrilled to be here. This panel is going to be all about communication, connection, and social prescribing just does that so well. And social prescribing actually helps people, enables people to change their story and to live the life that they want to lead. So I'm really thrilled to be here. Thank you for listening. Thank you for being part of it. It's going to be interactive. I want to make this engaging and exciting, and I want you to all get something from it. So without further ado, the best stories are always told by the people themselves. So I'm going to start the panel off by showing a little montage clip of Podcast on Prescription. I hope you've all listened. If you haven't, then check it out. It's a podcast that I've been really honoured to do as part of the National Academy for Social Prescribing, and we've had some incredible people. We're on our second season, so without further ado, let's hear a little bit from that series.
And I went to see my doctor that day, and he actually said, you know, you're suffering from mild depression. Do you want to take some drugs? And I said, I'm not taking drugs. And he said to me, well, if you're not going to take any drugs, then whatever you love, go and do more of it. And that was the best thing that anyone had said to me up until then. You know, I just went home, got my binoculars, and went to Wormwood Scrubs, and it was birding and it was nature that actually pulled me out.
For me, it was very much realising that it has made a huge difference in my life. It's sometimes, it gives you a focus, I think the word I'm trying to use. It sometimes gives you a focus that you just need to just say, do you know what, I need to shake off whatever it is I'm feeling right now and just take to the streets, to the road, to the pavements, to the pathways, to the park, whatever it is, use my feet and just get a little bit of energy going through me and allow my thoughts and my feelings just to exist, but in the space of something different, in the space of an activity where I can just flow with it. And I think they're helping others because it became so apparent to me how through the running, you know, we raise so much money for charity. People raise such a lot of money through running and doing events and sponsorship and donations, and that does make such a difference to other people's lives.
I mean, one of the saddest and nicest stories was I went to pick a lady up, and I'm driving her thing, and she's in her 80s, and she just pulls the mask down a little bit, and she says, "You picked my friend up last week, didn't you?" I said, "Oh, how do you know him?" She said, "Well," she said, "my husband and him, and they met in the vets in about 1953. They both had the cats. They got chatting, and they became friends. And the four of them, two couples, would go to this club twice a week, and they got on for like 50 years, you know."
Wow.
And they both had lost their partners in the recent years, but they still met and went to the club together on a Tuesday and a Saturday. And she described, she would walk to the end of her road, he would cross the road and meet her there, and they would walk up to the club together, and they would go for drinks and then come back. So I said, "Oh," I said, "that's lovely that you still did that." She said, "Yeah, but we've not We've not done it for a year, obviously. I said, oh, what do you do instead? She said, well, we speak on the phone every now and then, but it's not the same. I said, have you not seen him? She said, no. I went, come on. I went, I've got somebody here for you. And she was on the drive in the car, and they put the window down, and they were like, they had a big chat. I felt like a gooseberry, even though they were not romantically involved. Yeah, but it was great. It was such a, and that, you know, that made my week. You know, that was, you know, I got as much joy out of that as they did.
What we want to tell are the stories of everyone's heritage, and to be able to engage with, you know, what people like us experienced in the past, and know where we came from, but also what other people have experienced. I feel that history is very good at putting one's life in perspective and you know, exploring past lives and realizing that other people in the past, as the great historian G.M. Trevelyan once put it, live lives as actual as our own, is a sort of wonderful tonic for life.
I rung my mum and told her, and naturally my mum was upset, but she said, right, I'm walking up to the GP. While you're on the way home, I want you to ring them and tell them what you've told me, and I'll see you there. So that's what I did. I rung the GP, and the GP said, right, come straight here, and we'll have a talk. So that's what I did, and I will be forever thankful for my GP. My GP is amazing. She is part of the process in saving me, in bringing me back. You know, and she will always say, like we all do, rather, oh, I haven't done anything, you've done it all. But she has, because she listened to me, and she understood, and she said, right, we're going to sort this out.
So an incredible set of clips, the incredible Daz Dula finishing off there, who's just brilliant, because what he did was he went and took all of that energy and that GP who enabled him to change his story in his life, and he took that and he became a link worker himself and is now helping people and enabling people to change their own stories. That's absolutely fantastic. And a bit of a plug, we've got a link worker special coming out next week, next Wednesday, to celebrate all the link workers, to champion what they do. So I hope you can all tune into that next Wednesday. But on to the panel today. This is all about people's stories, and social prescribing really, I think, enables people to change their stories on an individual level, like we've just heard, on a regional and community level, but also on a national level. And so I'm going to look at those three levels in the panel today. And I've got some brilliant projects, some brilliant guests I'm going to be showcasing. What I'd like you to do is, again, you've got your postcards with you in your packs. Please think about, what is your story within social prescribing? What's your journey been? What stories have you seen, and how have they impacted you? How have they impacted other people that you've worked with in your community? And please get writing those down. Please share those on the board outside afterwards. Please share them on social media using our hashtag, because we want to get people talking. We want to make sure people are actually hearing people's stories. So without further ado, we're going to move on to how individuals' stories can be enabled and supported through social prescribing. And my first guest is with me. She's fantastic. She's called Katrina Gargett, and she's a community engagement officer who runs the Archaeology on Prescription project. And that project is all about improving the well-being of the City of York's residents through archaeology, helping foster social connections and build confidence with new skills. So thank you so much, Katrina, for coming on the panel today, coming all the way down from York.
Yes, it's so nice to be here.
Now, tell us a little bit more about your projects, and more importantly, how does it actually change people's lives and their own stories from what you've seen?
Oh, I don't know where to begin. That's such a big question. So the project itself is still sort of in its pilot phases. We kind of I got back from being furloughed for a long time after the pandemic in April last year, and kind of so I went headfirst into developing a social prescribing project using archaeology, because it's well documented that kind of engagement in heritage can improve health and well-being, and we wanted to look at how we could use that with social prescribing. So I kind of got in touch with local non-statutory project partners, rather than sort of jumping in head first with kind of connecting with link workers and things. And we set up a partnership with two local charitable organisations. So one of those is Converge, who are based at York St John University, and they work with students with mental health difficulties. And the other is Changing Lives, who I'm sure many people know work with people recovering from addiction. And we just said, hey, do you want to come down and do some archaeology and get involved and see kind of what the health and wellbeing benefits of that will be, and make new friends, and kind of just sort of have a go. So we set up our first 9-week pilot that ran from September to November in the autumn of last year. We were very kind of particular in that we wanted to offer a sort of range of archaeological activities and also creative activities to enable the participants who came down onto site to sort of take a bit of agency and do what they wanted to do based on their own interests and their own needs in the past, and in archaeology. And the response was just incredible. It was amazing.
So tell me a bit more about the response. When you say it's incredible, what happened? What did you see? What did you see on the ground in terms of what people felt about that project and how they interacted with it?
Well, first and foremost, it was kind of, we had so much enthusiasm for the people that were coming onto the project, because we were sort of aiming it at people who'd never had an opportunity to have a go at archaeology. And so many of them on that kind of very first week were saying, I can't believe I'm here, like this is amazing. I never thought that I'd be able to get into a trench and pick up a trowel and actually, you know, try and find something. And that enthusiasm just sort of built and built and built as the pilot went on, and sort of across those 9 weeks. But I think that particularly for the staff ourselves who were delivering it, we weren't quite ready for just how much of a profound impact it was going to have on those participants, because they really, they just blossomed, really. They made new friends that sort of still keep in touch now, which is incredible. Wow. They sort of developed their skills and their knowledge, and they learned so much about the past, and that really kind of fostered this sort of sense of belonging. And they noted at the end of that 9 weeks that they'd really experienced that kind of positive increase in well-being, from just coming onto site every week, having a go, you know, finding objects in the ground, whatever that might be, experiencing that sense of discovery, that sense of wonder that comes with archaeology, and also being a part of something bigger in this sort of shared pursuit of discovery.
Wow, I love that. And I suppose also, when we hear the word archaeology, we automatically think of something quite grand, something exotic, something abroad. Yeah. But actually to kind of maybe reframe that idea about what archaeology is and how the past can influence us in terms of our local area, in terms of really small objects and just the whole point of discovery, I suppose. I'm always really interested in how that kind of bigger theme is reflected in an individual's life and their story. So I suppose as they were discovering objects, do you feel like they were discovering a bit more about themselves and who they were as well?
Yeah, I think so. I think because archaeology is fundamentally about people. It's about, you know, it's about people in the past and what we can discover through the objects that we're finding and the evidence that we have, so that we can learn and understand better about who those people were that came before us. And I think through doing that and through sort of finding these objects and using their imagination to think about who those people were and what kind of lives they might have led, and were their lives different to theirs, or were they very similar to theirs? Did they face the same kind of challenges? It sort of allows you to reflect on your own life and your own experiences, and how that's kind of brought you to where you are today. And I think just through having those kind of really open conversations with the participants in the trench about those people who came before and who was using that piece of pottery that was just discovered and what their life might have looked like, they really began to open up about their own lives and the challenges that they'd faced. And there was this real sort of sense of camaraderie and sort of a sense of belonging and coming together in kind of that shared social connection. So it was really, really powerful.
Wow. And they've also, I suppose, have created their own shared story within their group now, of that activity, those weeks they spent together, and that's also part of their story and continues to be, because obviously, as you said, they're all still in touch, which is amazing, which is what social prescribing is all about, which is fantastic. I know that you've got a brilliant video that you kindly have agreed to share with us. Can you just tell us a bit about the video before we watch it?
Yeah, so the video is one of our lovely participants who came onto the project, called Nellie. And she has quite challenging disabilities, and she spends quite a lot of time in bed, as you'll hear us sort of describe on the project, but she'd never had a chance to have a go at archaeology, and it's sort of always been one of her passions. So when she kind of heard through Converge that this was an opportunity, she just said, you know, she had to come down, and you'll see from the video, she, you know, she really kind of overcame a lot of her kind of own challenges and really took agency over her experience as well. Not only did she have a go at excavating, but she also took the lead on a collaborative arts project that they did on site as well, looking at sort of their experience of the site and the sort of layers of archaeology and things like that. So yeah, it's a really inspiring video, and I hope you all enjoy it.
That's amazing. Thanks so much. We're going to have a look at it now, I think.
How did you get involved in the project?
Well, it was through Converge, and they've got lots of options, and I was just like, oh, this one, I've got to do this one, I've got to do this one. It just sounds so amazing.
So have you enjoyed your time then?
No, it's been horrible.
Oh, yeah.
Yeah. It's amazing. I absolutely loved every minute of it. In fact, started off as one afternoon a week, and the last couple of weeks I've been 3 days a week. And for me, that's just unbelievable, because I spend so much time having to be in bed, and to be able to say that not only have I been out of bed, but I feel like I've learnt so much, and I have got I've used some new friends as well, and the team are just amazing to work with. There's so much laughter and learning, and they're so knowledgeable, and I just can't express enough how much I love being part of this team. It's amazing. And I just spoke to my doctor now, and he said, what? And I was like, yeah, just starting again in next year, so you gotta tell people about it. Because he couldn't believe that it was on prescription. So I was like, oh, yeah. I really don't want to tell people about it though, you know, because I want to come back.
So what's been your favourite part? Or your favourite moment?
I can't tell you one. I can tell you a couple, because between the two, they're two completely different things. Whilst I was digging, I found something. But what was the best one was when I was washing the finds. I was just like, oh my God, this is amazing. And I found a tile with 2 fingerprints on the end of it, and some, I think it was grass marks. And it was just like, oh, I'm holding something that somebody made, and I can actually see their fingerprints. And it was just, what a connection.
Yeah.
That has just like made my day. So that's the archaeology side of it, in terms of, you know, the actual dig and the finds. But for actually being able to do the art project, that has been inspired by, one of my friends helped me brainstorm what would be a good idea. And she's really chuffed that I've done it, and I've been sending her pictures of, you know, going along with it. So yeah, so being able to do all that, whilst having, I have to say, whilst having a disability, that everyone's just accepted me as I am, and just a crazy person that I can be. And I've loved every single second. I am so sad. Don't let get a copy. I'm so sad that it's finishing today. For me, anyway.
I'm going to give you a big hug in a second. But that's it. Is there anything else that you wanted to say?
Thank you.
Wow. Wow, what a reaction, what a story, what a transformation as well, and something like you say, that people, they've now become a group and they're now in touch with each other ongoing. Thank you for sharing that with us, and thank you to Nellie, and thank you to everyone who is working on that project and has worked on that project. Just before I leave you, is there one sort of standout moment that you would take from that pilot in terms of the power of connecting people and their stories, and what you've seen it sort of enable people to do in their own lives?
Oh, I think one standout moment's hard, because there's so many in my head. I think every day was just kind of, there was so much fun, like Nellie said, and there was so much laughter. And I think, you know, through that and kind of breaking down the barriers and making everybody feel welcome, there were so many moments where people really opened up about kind of things that they found challenging, and that the difficulties they were facing in their lives, that they said that they never would have known that they would get to that point where they felt like sharing that with someone. There was one particular participant who rang me after the end of the first 9 weeks, And I'll never forget it, because I was walking through town and it was raining and it was such a horrible day, and I'd had not the best day in the office, missing being out on site. And she rang me and she just said, I just want you to know that you've completely changed my life. She was like, I don't know if you knew, but I had really bad agoraphobia from the pandemic. And she'd never had a chance, a bit like Nellie, never had a chance to kind of get out and do archaeology, but it had always been a passion of hers. And she said, I feel so much more confident to leave the house now because of this project, and because you all made me feel so welcome, and you made me realise that it's not as scary, the world isn't as scary a place as I thought it would be. And she was in tears on the phone, and I was in tears on the phone, and it was just that moment that was kind of like, you know, archaeology has that power, and through social prescribing, we just want to change as many people's lives as we can.
That's incredible. And I bet your day was a lot better after that.
It was, yeah. The rain didn't matter after that.
Well, listen, Katrina, thank you so much, not just for your work, but for coming here today and sharing that story with us as well. Thank you to everyone who works with you as well. I'm going to move on now to that other level of community and regional impact in terms of the story of a community and a region that's been impacted by social prescribing. And I'm really thrilled that Anne Dement has joined us today. Thank you for being patient, Anne. It's really nice to have you here. So Anne is the Thriving Communities Spark Somerset Project's Creativity and Wellbeing Coordinator, all the way from Somerset that you've come, so thank you so much for being here today. Can you just tell us a little bit about your projects, and importantly, how the story of your community and your region has been transformed by social prescribing?
Thank you, Rada. It's a pleasure to be here and hear all these wonderful, positive stories. Thriving Communities Somerset was funded by the Thriving Communities Fund from NASP, and the aim of the project is to strengthen and build the social prescribing networks that are already there. Because Somerset's divided into 4 different district councils, and in each district there were things happening, but they weren't being connected. So the aim of this project was to support the people most impacted by COVID and long-term health conditions by helping to facilitate and strengthen those networks. So we started with simple having roadshow events for one in each region, to get all the people in the same room talking, like today, everyone talking and sharing stories and knowing what's already there, and making new connections and forming new ideas to see what they could take forward and build new collaborations, which were very successful. We had 159 people attend all 4 events. Unfortunately, only one was in person because of the restrictions. But we had about over 90 different organisations represented, so link workers, commissioners, funders, the Health Watch organisation were there, the Somerset Community Foundation, and also the smaller activity providers who don't normally have a voice, but they were there and they shared what they do. So everyone understood, and it was really powerful.
It sounds really powerful. And just like we've been hearing how individuals have been kind of knitted together and connected together through social prescribing, it sounds like your region was actually knitted together and connected through social prescribing as well, because of those events and because of people coming together.
Yeah, and actually I say only one was in person, but actually being online was a sort of a benefit, because they were recorded on Zoom. So people who from any region of Somerset could actually watch or attend, and also because of the difficulties in travel and obviously the restrictions on people accessing live events, it gave more people the opportunity to attend the events, so it had a wider impact.
So in practice, if we're looking at different aspects within a community, within a region, obviously there are so many different aspects of well-being, different organisations, different people, and different, I suppose, environments that people will come across as individuals in their own lives. Can you give us some examples of how those different elements in the community were actually brought together on sort of practical terms?
Yeah, so apart, as well as the roadshow events, which we gave people an opportunity to try out some of the social prescribing activities that we were going to be supporting, our project funding also had money to commission activities, and in my role, which was quite challenging, but in 8 months or 10 months, I had to identify and commission and support the activities to be set up and run. So we've supported 7 projects, and the initial aim was to try and do some in every region of Somerset, so allow every area of the county to experience an activity, but also to work with existing and new providers and provide new collaborations. So just for example, we set up a Thriving Voices choir, which obviously knows the benefits of singing, but we connected with the long COVID and the respiratory rehab teams who were working extremely hard in the last few years. You had a lot of patients who have been isolated and unable to leave the house, but we managed to set up 2 choirs in Burnham-on-Sea and in Taunton, and these people were able to get out and actually learn about breathing control and connect with other people and sing, and they've actually managed to get funding to carry on those choirs, which is amazing. New partnerships, and we connected Somerset Artworks, which is an arts organisation, with Somerset Wildlife Trust, and the Mind Art group, which was existing, but they were struggling to get people to attend, and they worked together, and we put those together to do an arts and nature course. And I was there on Tuesday and speaking to the participants, and you know, it's not just about doing the art activity, it's about, they said it's about having a cup of tea with people, about connecting. There was a lady I spoke to who had epilepsy, and she wasn't able to leave the house without somebody to give her a lift because she couldn't drive. And Somerset's quite a rural community as well, so transport is quite a challenge to access activities. So just the being able to access a group once a week, and also they got taken out to the local, the Quantock Hills and natural, to do experience in natural environment as well, and do nature-based activities. And I've got some wonderful stories from Meads and Marshes, where the Meads is a wetland site in Bridgewater, which Bridgewater is quite an interesting place, but it's quite a deprived area of Somerset, and we set up a mindfulness and art group there, and I've had some really powerful stories from that, just people being able to access and learn how to mindfully observe the area around them, you know, and actually go out and visit a wetland and wildfowl trust at Sturt Marshes, which is absolutely beautiful.
Yeah, it sounds absolutely beautiful, and sounds like all of those parts were knitted together in a really lovely way, and there was lots of synergy between different organisations and the community to actually, like I say, get the best out of everyone, but connect people up so that we're all kind of working from the same page, or supporting each other anyway to do our own expertise, but to kind of create that environment and that group of support. You mentioned obviously that was kind of set up after or during the pandemic, and obviously we know that's had a really big impact on people's lives. What do you think the impact of social prescribing has been in your region, in terms of looking at some of the difficulties and challenges that the pandemic has actually brought up or highlighted?
From the conversations, because we at the road shows, we asked people what have the challenges been to access and social prescribing events, what could we do to support them better, and transport was one of the #1 issues, obviously long-term funding, so projects, because all the feedback I've been getting from the projects we've supported is I've really enjoyed it, and like the lady in the Archaeology film, they're actually devastated when it has to end, because they're only funded for a certain time. So, you know, sustainability is something that we really need to think about. But yeah, the challenges have been actually knowing about the activities happening. So having these shared forums has been really beneficial, so people can share information and know where these activities are listed, or know who to go to ask to see what activities are available in their area. And actually just being able to access them on the confidence of people to go out again after being at home for so long. You know, they've got a certain fear about going out, and just not having that social experience, you know, actually having the confidence. And most of the groups that we've been, the activities that we've commissioned have been quite small, supported groups. For example, the Earn a Bike project in Bridgewater, which was an existing charity that helps people learn how to strip down and rebuild their bikes and actually keep the bike at the end of it, which is a brilliant project. We paired them up with Somerset Films so they could learn digital skills to learn how to film themselves doing it. And that only had 2 participants, but this is a brilliant story. One participant was an 18-year-old who had to access the activity with a support worker, and the other participant was a 73-year-old lady who wanted to learn new skills and actually learn how to maintain a bike so she could get out with her partner.
Wow, that's amazing.
So they would never have met or never had a chance to do that activity together without having this project and having it funded.
That is amazing. Like you say, the benefits there are just so large, aren't they, in terms of intergenerational communication, understanding. Like you say, they probably would never ever have met had it not been for that project. So That's incredible. Thank you so much for everything you're doing. And thank you for coming here today as well to share all your experiences. It's been absolutely brilliant. So that's been on a regional and a community level. And then obviously the national level, we've already heard a lot about art by post this morning, and we're going to hear more in one of the later sessions as well about art by post, because obviously that connected people's stories across a nation. So you can really see how there's that individual level, there's that regional level, and there's that national level in terms of how social prescribing is enabling people to change their stories and to live their lives how they want to live. So without further ado, I'm just going to now ask and open up the audience really for a few questions and comments and reflections. If anyone's got anyone would like to ask our brilliant panelists anything, that would be fantastic. Hopefully we'll get someone to ask a question. Oh, here we go.
That's a fabulous project, Katrina. I've heard about it, and I'm from the Restoration Trust. We're a very small charity, doing similar work to similar projects. I suppose now we're developing some more work in the heritage space. I'm just sort of feel like I'm pushing on a very closed door when it comes to what's currently used as CCGs and health partners, soon to be ICGs. You know, so their agenda is going to change altogether, isn't it? Being more difficult to engage. What sort of connection did you have, and how did you achieve some of that?
So for the first pilot, as I kind of mentioned earlier, we sort of connected with charities that we'd worked with before, that we know worked with the kind of people that we wanted to benefit from the project. But sort of moving forward, we have another pilot that's starting in April that we've very gratefully got funding for. And we've been trying to make connections with link workers, and it has been quite a long process. We're kind of lucky in York that we have what's called the Ways to Wellbeing team that sits within our VCS. And they are looking to kind of embed link workers in kind of secondary services across the city. So it's fairly well established in York. And through that, we've managed to kind of get the word out about the project. And we've now have link workers who are approaching us. But we're sort of looking at how we can balance working with the non-statutory partners and the kind of the individuals that are referred through the NHS and the link workers. And it's something that is kind of ongoing at the moment. We're just sort of working out those relationships and how it's going to work. But I think it's the social prescribing landscape, as we all know, sort of looks different in the various different places in the country. And we are looking to kind of take our archaeology on prescription model further afield to places like Nottingham and Sheffield, where we have other offices, and sort of work with other archaeological organisations like Wessex and places like that. So I think it's just, for us, we've been quite lucky that it is quite established, but it's still very much sort of a work in progress. And I feel like I've not really given you any kind of any tips there, but
Similar challenges, but
yeah.
opportunities as well, and of course, getting people to work across the sector. It's an ongoing relationship, isn't it? Just sort of any top tips. I'm here for the day, so.
Yeah, come and find me, because I feel like I can talk about it.
I think you should talk over coffee, definitely, 100%.
Can I add?
Talk about being part of the wider system.
Yeah.
That's important, so opportunities don't get lost in their own little silo. And we're just developing a heritage link work.
Yeah.
And it's to sort of try and sort of test and try and see what happens, sort of thing. So,
Thank you. I think Anne wanted to comment.
I just wanted to add, from my experience, the project I'm working on, we have 3 core funding partners, which are Somerset Wildlife Trust, Somerset Artworks and Spark, but we have a wider steering group, and on that steering group we have partners from the CCG, from Public Health, from the Citizens Advice Bureau, from the wider advisory bodies, and actually that's really helped, because that has increased engagement, and actually saying, well, we're already doing this, perhaps we could collaborate. For example, one of our roadshow events, we collaborated with Citizens Advice because they normally do a winter wellbeing event. So that was a really good opportunity to bring the people who would come in, for helping people to heat their homes and mental health support and financial wellbeing and discharge teams to come and join our event. And actually that had actually produced a really good, my 7th project, which is Postcards of Recovery, which local hospital arts coordinator is developing postcards for people coming home from hospital to have an activity to do for 7 days. So that was purely from a conversation at one of these networking events.
Fantastic. Thank you so much. Thank you for that question. It's really good to share learning and experience, isn't it? So we can all kind of learn ourselves. I think, unfortunately, we haven't really got time for any other questions. Sorry, I'm just a bit aware of time. But I want to say thank you so much to Katrina and Anne for coming all the way and sharing your incredible work and what you do. Can we all give them a round of applause for coming? And I want to say a big thank you to all the participants who are in those films and videos, everyone who's shared their story, who's been open enough to be vulnerable to share their experiences, because it helps all of us. So thank you. Thank you to all of you for listening, for paying attention, for being engaged. Please fill in your postcards about your story within social prescribing. We'd love to see those. Please share them on social media and get talking, because that's what this is all about. I'm just going to leave you now with a very short clip to finish off, a little bit more podcast on prescription, why not? I hope you enjoy it. I hope this has inspired you. Thank you for all you do. Keep inspiring other people to live the life that they would like to live. Thank you so much.
Nature is your garden, nature is your houseplant, nature is your local park, nature is the moss that's growing on the wall outside your school. And those things are really, really important. And we are genetically built to respond to nature.
It's about where am I at now, where do I want to go, and what small, tangible thing can I do today and tomorrow that can help me move forward.
So yeah, I think that financial prescribing is not very well known at the moment, but I think it could become a really important part of the toolbox for addressing people's overall kind of issues with their well-being and getting people to a better place.
Do you think that social prescribing would have helped you at that point in your journey?
Yes, because I think an additional benefit of social prescribing is that when you connect with somebody, you're also exchanging information.
With lockdown, they realised that the rest of the world, sometimes for the first time, understood what it was like to be isolated from the people you care about, from the people you work with. And so it made people understand how difficult it is to be isolated.
Every time I've ever picked anybody up and taken them for their jab or taken them to get their hair done or wherever, I have got more out of that than it's cost me. Definitely, 100%. And I like being in the car talking to people, driving about doing nothing. You know, that's what my job is, and I wasn't doing that. So, hey, that's why I do it.
The water doesn't care. It really does not care about who you are, what you look like. Do you have a disability? Are you able-bodied? You know, it doesn't care. It really does not care. And that's where I think social prescribing is so amazing.
Welcome back. Show of hands, my tea drinkers, who got a tea? Where's my coffee, people? You can hear it, can't you? You can hear the difference. Welcome back. By a show of hands, how many of you filled out your postcard for the last session and put it out? Beautiful, thank you very much. Show of hands, how many of you have used the tweet with our hashtag? Yes, that's what I'm talking about. Beautiful. We have a wonderful panel lined up, already here waiting for you, ready to go. The workforce is vital for social prescribing to work. So this panel is all about supporting the social prescribing workforce. I do want to make a quick note that we actually have, you know, the captions on the screen. This is a story all about how my life got turned upside down. I thought, how on earth is this AI doing it that quickly and actually being accurate? I've learned it's not AI. Just at the back, there's a team, and they're working 15-minute intervals, and they're typing away. So when you have a question, if you can come over to the microphone so they can hear you, and also our Zoomers can only hear what's said on the microphone. Otherwise, they're just watching going, is my sound, have I muted? So we've got questions at the end. Come on up to the front. Feel free to queue as well, that's fine. And use the microphones so they can get the captions and the Zoomers can hear you. Zoomers, we haven't forgotten about you. Welcome back. So it's my pleasure for this panel to introduce Bev Taylor and Gay Palmer. If we can get to 10 again, please.
Hello and thank you. This is great to be here. I'm here with Gay. We're from the National Academy for Social Prescribing. Gay's on our board and is a link worker, and I work on strategy. But we've got some fantastic people here to tell you about the offer that they have and what they've been doing to support social prescribing link workers and the wider workforce, and things that you can connect to that might be of use. So I'm looking right over there. We've got the lovely Najneen from the National Academy, who's supporting the offer for link workers. We've got Christiana from the National Association for Link Workers, who's been doing lots with link workers and is going to tell us more. We've got Nick Gitcham, who leads social prescribing from NHS England, where you've been doing lots of different things, and we're going to hear more about that. It's great to have Harminder Baines from Health Education England. Lots to tell us in a couple of minutes, and I'm going to be the bad cop who keeps to time and goes, you've got 1 minute, guys, because we've got quite a lot to get to. But before I do that, I'm going to hand over to my fantastic co-chair, Gay. Tell us about link workers. Why are they important? What needs to happen, Gay?
Good morning, everyone. Any link workers in the house? Oh, I'm going to try that again. Any link workers here? Excellent. The chances are the other link workers are actually busy doing the work. So that's why they're not here today. But I can tell you what is amazing and powerful about the role that we do, because this is what I do for my job Monday to Friday. As we heard earlier on in the previous session about the power of the stories. And that sometimes is the reasons why we get up every morning. It is quite frustrating and quite sometimes there are tensions, but to hear the thank yous and the well dones are simply quite amazing. To know that we're that listening voice, that confidant, that person that a person feels empowered to speak to. Someone even called me a counsellor. I was like, no, I have not got those qualifications. I don't want them. But the fact that she felt she was comfortable to come and talk to me so I could help her, that's the importance of the link workers. So link workers, if you're listening and if you do get to watch this later on, thank you very much for all the amazing work that you do. It has never gone unnoticed. Even today, we know the number of contacts exceeded what we thought we could do in a short 5-year period. We've exceeded that already. So that shows you the importance and the power of link workers. Now, as I said, you get the good days where it's like, I'm a champion, I can do all of this. And there's other days thinking, actually, I'd rather just go back to bed and start all over again. What's really important about what we do is having these amazing teams right here supporting us. So while we're supporting the communities and the individuals, we're going to hear a bit more about how these amazing teams are supporting us as the link workers, developing the skills. We're emerging. We're very, very different. We're working in primary care networks. We're working in the voluntary care sector. We're working all over, but it's really important that our role is reinforced, that we're supported, that we're valued as link workers. I'm going to hand over to Harminder, who's going to start. Tell us more.
Okay, so thank you for everybody for having me here today. I'm a programme lead and I work in the primary and integrated care team at Health Education England. And what I'm responsible for is, and I'm not sure if you'll know, the additional role reimbursement scheme in terms of the education and training. Social prescribing link workers is one of those roles. And for me, I don't do anything in isolation. We absolutely need to hear that social prescribing link workers. So I'm going to just name a couple of things that we've done. When I say we don't do anything in isolation, we work really closely with NHS EI colleagues, developing the educational curriculum to really support social prescribing link workers. So a couple of things that we've done. We've supported the competency framework. So that's something that's some of you may have already seen. So really acknowledging, not necessarily the qualifications that we're aspiring to, but also actually the lived experience, the experience that social prescribing link workers bring with them from previous roles, from the voluntary community sector, organisations. We've developed some online learning modules. We've got 11 of them at the moment, and that has been done with NHS England and is available. But one that's relatively new that I think is worth kind of sharing is the module around veterans' health. So actually the veterans have very distinct requirements, or they're a community that actually may require some specialised skills. So in terms of the social prescribing link workers, you'll find you're probably niche and specialised in certain areas. Our role is to listen, is to understand what some of the patient populations are, and actually how can we support in that education space. I speak about online learning modules. I'm an educationist by background, and I kind of didn't go through school, you know, plain sailing, completing my GCSEs in that form that, you know, achieving each and every year. Actually, vocational education was my path. So I'm really pleased to say that we've supported the community and the community health work. Community, I always get this wrong. A community health worker apprenticeship framework, which is available for social prescribing link workers and other personalised care roles. So again, it gives people an opportunity that haven't ever probably got a qualification, aren't necessarily interested in online learning modules, to actually access some form of education. And that then, for me, helps the social prescribing link worker gain qualifications if they want to, but also helps them in terms of that retention and having someone to have a conversation with, because like Dave says, you have your good days and you have not so good days. And actually that leads me on to the safe space to have a conversation. So we've heard quite a lot of stories, but actually what's the support that's out there for you in terms of that retention? Where's your safe space to have the conversation? And what we've done, and we're piloting at the moment, is this our training hubs, not all of them, so we've got 42 across the country, but they are pulling together group professional support sessions, and they are action learning sets. So there's a space for social prescribers to go to have a conversation about whatever it might be. And what we're hoping will come out of that is some training needs analysis to say, actually, there's a gap here and we need to do this. There's loads of other stuff that we do with training hubs, but I'm happy to talk about that later.
That's really interesting. I'd not really understood the power of those action learning sets, so that's great to hear about those. We'd love to hear more. Okay, we're moving on. Nick, tell us about what NHS England's been doing and what's important in this space to you.
Fantastic. Thanks, Bev. And it's brilliant to be here with so many partners that are helping us develop the fantastic social prescribing workforce. So over the last year, we've been really listening to link workers, to employers, to PCNs and to our stakeholders about how we can really add to the existing support offer, but also develop a more sustainable and professional approach to developing this really important workforce. We carried out a survey. We had over 450 link workers respond. And they overwhelmingly told us that they believe their job made a difference to wider determinants of health, and the majority would recommend their job to others. But they did say they had concerns about lack of supervision, line management, being part of multidisciplinary teams, and struggling to see their role being understood and valued. So we've been doing a range of things. So one of the big things we're doing is working with all of those stakeholders I talked about to develop a social prescribing workforce framework. So this will bring everything together for employers and those that direct the activities of link workers and link workers themselves to really set out how to understand the role, how to maximise its impact, what are the key competencies, and what are the support structures that must be in place to help this flourish. We're going to be sharing this. We're doing it in a very collaborative way. It's going to be up on our NHS collaborative platform over the spring. We're putting the first bit out next week, which is the competency framework. We'd really like people to comment. The other thing is we've been adding to our existing offer. So the e-learning working with HEE. We've also just launching this week a children and young people's module. We've done a module on supervision this year, which is really popular, and we're about to do one on culturally responsive practice. We've got our fortnightly webinars. If you haven't listened to them, we've got great backlog and back catalogue. Really encourage you to have a look at that. This week's was on population health management, workforce development. Working around HEE training hubs, and we've got our fabulous regional learning coordinators and primary care advisors that are out there to support people to make a difference. We've been working with National Association of Link Workers and with NASP, and they'll both talk about some of the things that we've been doing there, and continue to work with primary care on some of those wider issues, such as clinical governance and multidisciplinary working. So our call for action really today is for social prescribing link workers, their managers, and everybody interested in the development of social prescribing to join us in developing this workforce development framework, and do that by joining the collaborative platform at NHS England, which we'll share and tweet widely through this event. So,
wow, that's amazing. That's 4 minutes. That's a brilliant summary.
I was warned.
Thank you. That's great. Go on, Gay, you introduce our next participant, please.
So our next participant, who is going to share a little bit more about her work, is, what's the name? Christiana Mellem. Sorry.
I can't believe you forgot that. I've been championing you guys and you forgot my name.
How can we forget you, Christiana? You are an amazing leader. Tell
Anyway,
us more about what you've been up to.
Okay, so when I go to speak at these events, I feel that it would not happen if we didn't have social prescribing link workers. So I think it would be wrong if we don't give them a round of applause. So can we do that, please? Thank you, thank you. So social prescribing link workers are leading on a groundbreaking transformation in terms of how the healthcare system is being delivered in this country and also globally. So I think we should understand that this is groundbreaking. It's not fluffy stuff. So we are driving change and we need everyone to be with us with that change. This is about social justice and about inequalities. So by increasing the number of social prescribing link workers, we are tackling inequalities and social justice because it is a role that values lived experience. So we cannot be having a healthcare system that is not representative of the population that it serves. So, like you would expect, there is burnout issues. So the pandemic has highlighted the need for social prescribing link workers, and people are recognizing the impact that it has. So it's good that we have commitment to have more social prescribing link workers, but we need to recruit more. So my call to everyone here is tell your families, tell your friends, your partner, your dogs, your enemies, everybody that is interested in becoming social prescribing link workers, help us to actually spread that word. A lot of people don't still understand what social prescribing link workers do, and don't just feel that it's just the people on this panel, it's not just our responsibility, it is a collective responsibility to help people to understand the role that they do. It is a collective responsibility to make sure that social prescribing link workers actually succeed, because we've tried so many things, patching people up. James covered in his presentation where we are focusing in a downstream service where it's almost like a crisis. You need to get to the crisis point before you get help. Social prescribing link workers enables the community to influence health and well-being. They enable patients and communities to be the ones driving the change. It validates the contribution that communities play in health and well-being. So all the stories we've heard and all the things we're hearing today, it's not fluffy stuff, it is evidence-based. Interventions have not been working correctly because we don't have a social prescribing link worker who is able to remove those barriers, who is able to advocate for people, who is able to drive the social policy, who is able to say, this person matters, what matters to them is important, who is able to make people feel valued, and most importantly, to make sure that underserved communities and people that are facing social injustice actually have a voice. So it's very important to understand their role in advocating and driving change. Now we do have issues. It is a transformative program. So there are issues around supervision. There are issues around education and qualification. Yes, some people come into the role with prior qualification. Some of them don't have the qualifications. They've come through their lived experience. But we do have a collective responsibility to make sure that that contribution is validated. We do have a responsibility to social mobility through the social prescribing prescribing link worker workforce, not just supporting people, but actually bringing in those diverse communities. So I would like to see more diversity in the social prescribing workforce. We need to apply an EDI lens. We need to make sure that we are taking down barriers. It is something that requires creative disruption. We cannot just be using traditional recruitment strategies. I want the NHS jobs to stop advertising social prescribing link worker jobs there. Go to the mosques, go to the churches, go everywhere, go to the streets and call on people to become social prescribing link workers. So it's for you to go out there, advocate for them, advocate for what they need. If you actually have got community assets, you've got things, set up groups and just be making noise. Write to your MPs, send them messages on Twitter, say yes, they need support, they need to have qualifications, they have educational needs. What can you do? So the national partners have got some things that they can do. What can you as a link worker do? What can you as the person listening online, the person in this room, you on Twitter, how can you help us? How can you help this social revolution on well-being? It's not just for me to actually solve. How can you help us to drive the social injustice, the inequalities that is driving this nation to a halt? What can you do about it? It is by actually standing with social prescribing link workers. It is about what you can do as an individual to make sure that their needs are met, to make sure they're not suffering burnout, to make sure that the 4,500 commitment of social prescribing link workers, which that money is about to go now, we've only got a few more years to utilize that funding. Go and advocate to the primary care networks. Go and advocate to the local authorities. Go and advocate to your MPs. Go and advocate to the integrated care system to make sure that we protect this workforce. We must protect them. We must protect them for yourself, for your families, and for the people they serve. Thank you.
Wow. Okay, we love your passionate commitment. That's amazing. Thank you. Najneen, tell us more. I know that's quite a hard one to follow, but
Thanks, Christiana.
You've joined the National Academy for Social Prescribing and you're coordinating support for link workers. Tell us a bit more, please.
Yes, actually. So I'm going to start off with the champions, actually, just because it's fitting since all that passion that you're talking about. And we are talking about a social revolution of change. And so Social Prescribing Champions, if you haven't heard of it, it's currently a pilot with the official launching on the 9th of March, so next week. And it's a joint collaboration with NHS England, and Bogdan over there has been leading on it with Julie Lowe at NHS England and I. And it's a programme of champions. So it's more about providing link worker allies within the healthcare system. So it's not just about primary care, it's thinking about secondary care as well as community settings. What's really important and I think really amazing about the champions is that it's not just open for clinical workforce, it's also those non-clinical workforce that are really essential and core members of our healthcare system. So people like discharge coordinators, the front of house at the GP receptionists, which have a wealth of information about our patients in the service. So do spread the word, and you can, I did have some slides, so do follow Bogdan, and if there's any information, do contact him directly. But applications open on the 9th of March, so do spread the word. I'll move on to the portfolio of evidence. So we've been commissioned by NHS England and Improvement to work on to develop a portfolio of evidence for link workers to evidence the broad range of their practice, so their skills and the competency framework, and that's in line with the competency framework that NHS England and Improvement will be publishing quite soon, so do have a look out on that. And so we've had over 60 link workers and supervisors live test these materials, and we've created a suite of materials which include an observation tool, a reflective practice, we have some case study templates as well as feedback surveys, all sweet together in a portfolio, and the feedback has been overwhelmingly positive. We've had link workers across the country from different regions, from different employment settings, and there's definitely an appetite for this to be welcomed and used in practice, which is really positive. What we've seen, one of the main, which is not surprising, is the lack of protected time for link workers to have, particularly around reflective practice, and we know that that's a core element of clinical roles, and so this should be encouraged for those non-clinical roles as well, and not just link workers, but everyone that has a patient-facing role.
And so with that will come some guidance on how to use those tools in the portfolio of evidence. We'll also have some guidance for supervisors, the workplace supervisors, on how to familiarize themselves with the role. We recognize that there are lots of people within the primary care settings particularly that might not be familiar with the link worker role. Often it's confused with the social worker role. I think the draft competency framework will help sort of cement that, what that role is. So some exciting things to come and look forward to soon. So we aim to publish that for link workers to have readily available by early April. We're just in the editing phase, and so yeah, watch your space. So remember, 9th of March for the social prescribing application champions application forms, and keep an eye out on our website for the portfolio of evidence.
Thank you very much. That's a brilliant summary of lots of different aspects of the link worker offer. I think these fantastic people have been working incredibly hard to knit it together individually and collectively, so that's great. Can I just, we've got a few minutes, you may have a question for any of our panel, but we've only got 2 microphones. We haven't got any roving microphones, so if you want to ask a question, I'm going to ask you to put your hand up and then come to the front so that you can ask the question into the microphone. Otherwise, people on Zoom can't hear it. So, anybody want to ask a question to any of our panel? Okay, brilliant. Could you come to the front, please, and just ask your question?
Guinea pig here.
Thank you very much for being a guinea pig.
That's all right. Giles Woodhouse, I work for Wessex Archaeology. I'm a veteran and I've spent 10 years working with the military community in a professional capacity. So first, thank you for doing that module. But my question relates to a point, Hamid, you talked about providing, I think, supervision support for your link workers. Is that resource something that you can share with those that are actually delivering the social prescribing programs? Working across the heritage community, York Archaeological Trust, MOLA here today, it's something we've identified. I think that certainly you're talking about voluntary groups, small charities, they probably can't develop this themselves. So if we can have that support from a body like yours that's done a lot of work and research, I think that would be a really powerful, helpful thing to do for the practice community.
So absolutely. Am I okay to respond? Yeah.
Yeah, of course, go for it.
So absolutely. It is in pilot stage in terms of that professional support, and that will come to a close sort of March, and we'll have a look at the findings, but I will absolutely feed that in. Happy for you to get in contact with me so I can make sure that we're connected and we are supporting.
And perhaps just to add, I mean, Haminder, the HEE supervision module that we developed with you, that it's available through the Personalised Care Institute and through HEE, and if you join the collaborative platform at NHS England, good way to find, what's the latest and get the bulletin of what's out. But that's available for everyone to look at, and is incredibly popular at the moment.
Yeah, it's free, isn't it?
It's free. Yes, sorry, all the HEE modules are free. Online learning. Yeah.
Okay, thank you. I'm going to just ask if we've got time for one more question. Does anybody else have a question? If you don't, oh, brilliant. In the middle in yellow, please. Thank you.
Hello, hi, I'm Esther Watson. I'm the work for the National Academy for Social Prescribing as the South East Thriving Communities Regional Lead. I'm really interested, I see a financial social prescriber, a heritage social prescriber, audit risk specialisms, and I'm interested in how we're going to have is there a vision of how these amazing roles and the specialism are going to fit together in places? Sometimes it feels like, the good practices here, and you think, oh, they've got that, we haven't got that. It's a really difficult question, I'm really sorry, but I'm really interested in what your vision for the future is. Yeah.
Thank you, Esther. Do you know, I'm going to start with Najneen, because Najneen's led social prescribing schemes in London. Now, tell us more, Najneen, about how do all those specialists and generalists fit together?
So I think there's so many different examples across the country and not just London. So in terms of NASP, we're actually creating some case studies in terms of how we might incorporate specialisms within a hyperlocal level, looking at population health data, and that's informed decision making in terms of all the R's recruitment roles. I think there's also, so that I think that will support on going forward the next rounds of R's recruitments. There's also, I think there's so much with the portfolio of evidence as well, because it's such a broad range. Even if you do have a specialism, the skills and competencies and the behaviours that come with that, I think it's such an opportunity to have that documented and for link workers to reflect on their practice and to really tease out those skills that we don't necessarily have anywhere currently. And so that's why the portfolio of evidence is really important and will be heavily encouraged to use. And we also want to make sure that there's protective time for link workers to evidence and reflect on their practice, because it's such an important practice. You know, we are seeing link workers burnt out as core members of the primary care team. Primary care is just, you know, we know it's just struggling at the moment. So this is hopefully a tool to arm them with, to sort of help them build confidence.
Thank you. Can I just bring in Christiana first, and then I think you might all, this is quite a popular topic. Yeah. Christiana, tell us more.
I think that's a good question. And I think we should be very careful with the way we describe social prescribing link workers' role. And we need to understand how things actually work, because, I mean, we are about professional standards and competency and continuing professional development, and we've got a code of practice. So what we want is a baseline. I mean, you don't just stand up and be a specialist. You need to have a baseline first, because this is about protecting the integrity of the profession and protecting the patient, the communities we serve. So before we all start getting very excited, let's just make sure that there is that professional competency there. So everybody needs to have that baseline competency they need to have, and then their training needs and through professional supervision and other means identify what areas they want to go to. So we have people that are entering the profession directly to specialize in certain areas, and we have people that are entering the profession as generalists. But we need to have a baseline, and it has to be tailored based on local needs. It goes back to what I'm saying. This is about social justice and inequalities, and not just getting excited for getting excited's sake.
Okay, thank you. I tell you what I'm going to do. I'm just going to go through the panel to Gay, and then Esther, you can come back to us.
Lovely. Thank you. Just a couple of points. So the original social prescribing guidance from NHS England encouraged people to develop a shared plan for social prescribing, to work across all the partners. And I think with the new integrated care systems, it gives us a level that we can really take this up. If we can get health, local authorities, voluntary sector, all of the key bodies, including the, you know, nature and all of the partners together, to really look at that social prescribing workforce across the piece and how we develop that workforce across and look at the population health management needs, health inequalities information, and design that service, you know, the service, and work together collaboratively. I think that's really key, as well as looking at the activities. And I think the second point is exactly what Christiana said. You know, we're developing this workforce development framework to give that sort of context. You know, what are the core competencies of social prescribing link workers, regardless of where they work, regardless of who they're employed for? You know, what are they? And then where are the specialisms, and what additional expertise do you need to grow out from that? We've got Jo Crease here today. She's from my team. She's leading that piece of work. Great person to talk to about this. But I think,
can we ask Jo to wave, and then if anybody
wave, Jo.
Stand up, Jo.
Oh, she's virtual. Sorry,
right,
Jo.
Okay.
She'll wave from Brighton. That's brilliant. But I think we're seeing, for me, there are two things at NHS England that we're doing to really sort of be able to hang some things on. One is the workforce development framework, and then we can build out from that. The other one is, which will be coming soon, is a maturity framework, which really sets out for ICSs some of the key things that need to be in place to help social prescribing thrive. So workforce and activities, and really taking a more strategic approach to social prescribing.
Okay, so you can hear, can't you, that there's lots of things in the pipeline. There's lots of things just either being launched or just being launched or in the pipeline, and together they make a package. Harminder?
I said I'd get that apprenticeship title wrong. I've got the correct title.
Go on, go for it.
Community and Wellbeing Worker. So this is what Christiana was saying. What's the basics? What's the fundamentals? And then what Nick has said, actually, what's the ICS plans? What's the population health needs? Because I'm from Leicester. It's going to be very different, my requirements and the population of Leicester to, you know, coastal towns. So I think it's about getting those fundamentals, but absolutely looking at building on that with the framework in terms of that specialisms. And I don't want to repeat anything else that colleagues have said.
So the Community Wellbeing Worker Apprenticeship feels really important to me because it's about people who've been through social prescribing, who've benefited from it, people who might not have done all those educational qualifications, but have got fantastic support skills. It's about enabling them to be part of it. And I think that's fantastic. So thank you. Gay.
Yeah, so also at the moment in Southwark, we're also working with one of the financial organisations. So we're actually part of one of the Financial Shield programmes. So it's actually with Citizens Advice. So the link worker is financially and has the skills and knowledge, and they're merging the two roles together. So their financial skills, their debt management skills, and they're now bringing in the social prescribing side. So we're actually working together. So it's really about collaborating with all the other major organisations. It's how can we put the social prescribing element into this? Because ultimately what we're saying is social prescribing can fit anywhere, but it's really about using the core foundations of social prescribing and adding that extra niche, which is that specialist side. So they've got that specialist knowledge, but ultimately the social prescribing element, the empowerment, actually the social justice, really bringing that evidence along is where the common core foundation and what we're doing from this side actually works. So we are starting to see it. We're looking at working with hospital teams and the cancer teams and the learning disability teams. So again, it's all about using their skill of the specialists, but actually amalgamating and really merging it together with the actual core role of what social prescribing is all about.
Okay, thank you. Esther, you sounded like you might want to come back to us.
I was going to say, I meet lots of social prescribing link workers in the course of my week, and they're amazing people. They've got amazing skills. They've often got masses of experience in the community, and they're bringing that, and within their own teams they're sharing that expertise and developing it. But so I just want to say I really understand. I just really respect them, and I'm really pleased that they've got this stuff, that they will have that building block to bring those experiences to the party as well. But it's going to be the specialism. And just to say, I'm really, really excited to see the children and young people's workforce development, because it's a special interest in mine. So thank you very much.
And thanks for your leadership with children and young people as well, Esther. Really appreciate it.
Okay, thank you. We are running out of time. The worst thing that somebody like me could do is keep people from their lunch and from whatever is happening next. However, we have got one really important job to do as a panel, and that's to say thank you to the new student champions who are in our audience today, and to give them one of our lanyards just to say, hey, you're a student champion. Thank you for your work. So I'm going to ask 6 people to come up. I'm going to ask you to come to the side and where the steps are and walk onto the stage. I'm asking Wenton and Nabil and Mary and Veronica Falloy and Katie and Vanessa to come up, please, because we'd love to celebrate your work as student champions. Come and stand with us. So, just to get the logistics right, each of our panel are going to give you one of these lanyards to say thank you for your support for social prescribing. We're really excited about your work with us, and we're looking forward to hearing more as we go along. Thank you for being our student champions. Okay, yeah, just come and stand with us. Just come and stand to the side. That's brilliant. Really appreciate you being up for coming on the stage. We'll have a photo in a minute, but I just want to conclude this session. Gay, is there anything you want to say just to finish this off? Thank you for working with us on this, and we'll let these lot go and do their next thing in a minute. But last word from you.
My last word is superheroes don't always wear capes. So remember, there are the link workers, and the most important thing about link workers is it's really simple. Each one can reach one. So if each of us go back and talk about link working and the role, we can increase the work capacity by no end. Thank you very much for your time. Thank you.
Oh, brilliant, brilliant. Thank you so much. Not all superheroes race. I like that. I like that. Not all superheroes wear capes. If we can give them one more round of applause, they make their way off the stage. But thank you so much for your insight. Thanks so much for your input. Now, I am so glad we're getting to have these kinds of conversations, and I think that's such a good point. Like, I can think back to my childhood and literally give you like the individual names of these people who weren't in my direct family. They came from the local community, but gave me an opportunity to dig a bit deeper and start to find myself. So I don't think we can underestimate the level of impact you can have with one person. I am curious how far you've all come, actually. So just out of interest, who is London? Who's beautiful? I was going to say that means you haven't gone far, but this morning, my Uber, I stayed at a hotel 2 miles away, went to Liverpool Lime Street, and it was closed. I thought, awesome. I got into an Uber. I was like, it's only 2 miles. 20 minutes to get 2 miles. I live in Lincoln. If you need to get 2 miles, you get in your car, put it in your sat-nav, it will take you 2 minutes. If there's traffic, it will take you 4. And we get very frustrated when that happens. How you do it is amazing. Who's further than London? Beautiful. Where are you coming from? Huddersfield. Any Huddersfield in the house? Representing. It's beautiful. It's beautiful. Anywhere else? We've got Huddersfield. Yes. Glastonbury. Anyone from Glastonbury? Representing. It's beautiful. Oh, awesome. What a place. Where else have we got? So we've got Huddersfield, Glastonbury, London. Devon. Beautiful. I was going to ask again, but I'm seeing a pattern. Devon, where else? Stockton-on-Tees. I feel like that's further. I like it. Anywhere else? Yes. We have a winner. The Gold Coast of Australia. Good. That's commitment. That's commitment. I was feeling so smug about coming down from Lincoln. And I was like, I've travelled it took me 4 hours to get down last night. Wow. Beautiful, beautiful. Clap your hands loud as you can. I like it. I like it. So our panels are continuing ahead of lunch. Thank you so much for coming up and using the mics. Caption team, you've been beautiful. It's looking amazing. Our next session is all about how we can innovate using partnerships. I heard a phrase once that said, if you want to go fast, you should go alone. You know, we can get things done really quickly on our own. It's very tempting to take on a large workload ourselves because we feel like we can just get it done. And I heard saying, if you want to go far, go together. And I think that really sums up beautifully what our next panel is going to be about. Do take a second to get your postcards out and fill in your input from the last session that we've heard so that we can get those stuck up at the end as well. And then we will introduce our next chair. Is it something I said? Is it? I know, right? This is like the clap hands raised. I can't do it. I can't do it. I came to sit down and just listen. No worries. So our next panel, my pleasure to introduce Ingrid Abreu-Scherer. She is the head of Accelerating Innovation Program at NASP. So take a moment to finish writing down what you need to write down. And if you could give me a second to let everybody on the stage, please take a seat, panelists. Beautiful. And once again, to all our online listeners, our Zoomers, please continue to put your questions in. We're going to have someone reading them. They'll come down and ask your question on the microphone on your behalf as well. I do feel like I need to do a final check. I didn't ask at the beginning. I mentioned it, but I didn't actually find out. Are there any other Arsenal fans here? My people, thank you. I guess I've got to ask. Man United? Yes. I'm sorry to hear that. Chelsea? Liverpool? Okay, do you know what? I can't make any jokes. You guys are amazing. Man City? Ugh, I'm gonna get it out. It's Tottenham. I'm so sorry. I'm here for you. And if at lunch you want to explore making that change, like Sol Campbell did, come on over to Arsenal. We'd be glad to have you. Ladles and jelly spoons. If you could put your hands together for our next panel. Thank you very much.
Thank you so much for that welcome and for the introduction. And as a Spurs fan, yeah, I'm probably with you at the moment on that. So we have heard from incredible people and projects who've been doing some amazing things around social prescribing, and we're going to carry on. We're almost halfway through the day today, so we're going to carry on hearing from people and projects. But some of them have been working in social prescribing for a long time, for many years. They have a wealth of expertise and experience, and some have got involved fairly recently through the pandemic. And I'm from the Accelerating Innovation Program at NASP. And the aim of the program is to harness that momentum and build on the motivation and on the great enthusiasm that people have shown over the last 2 years, and especially to bring people together across the country in new partnerships and new collaborations. So we know that innovation isn't about shiny new widgets or tech solutions. It's about how we do things, new approaches to the challenges that we've seen in the last couple of years, and new solutions that come about through different ways of doing things and different kind of ideas as well. And in this panel, we wanted to discuss how new collaborations and partnerships can be harnessed to make a difference. As Kamal said, if you want to go far, go together. And so I want to introduce our panelists today who can tell you about how the work that they've been doing creates projects that are bigger than the sum of the parts. So first of all, I'd like to introduce Michael Shan from Carers UK and Cheryl Berry from Rotary Great Britain and Ireland, who are going to tell us about their partnership.
Thank you, Ingrid, and it's wonderful to be here today. Only my second event I've been to in the last 2 years. So we're here to celebrate the partnership between Carers UK and Rotary Great Britain and Northern Ireland. And this partnership was actually instigated by one of our volunteers, who was a volunteer for Carers UK over many years, and also a volunteer with Rotary, and a woman called Anne Blanche, who's done amazing things in West London, in her community there, to support lots of people, carers and many other people as well. And so Anne said, you know, I think you should get together with Rotary. And she needed to remind us a couple of times, but then when we did, we got this partnership together, started it maybe not on paper the best of times. It was in June 2020 in Carers Week, and but actually we've worked fantastically together, and it's been wonderful working with Cheryl and her team. Since then, it was initially going to be a 1-year partnership, but we were getting on so well and achieving so much together, we've extended it to a 3-year partnership. Next slide, please. Actually, the next one after that. Right, so I thought it'd just be nice just to start off with talking a little about carers. Many of you will be familiar with unpaid carers, but this is Carers UK's definition of a carer. So if you provide unpaid support for a family member, friend or neighbour, you could be defined as a carer. They may need your support because of a disability, illness, mental health condition, or because of their age. And as I'm sure you all appreciate, carers make a huge contribution to our society. Some of you here today will be carers, and I'm sure all of you will know of a family member, friend or colleague who is a carer. And 2/3 of us during our lifetimes will become carers. Next slide, please. Right, so just a little bit about our organisations, if you're not familiar with us. So Carers UK aims to make life better for the UK's 6.5 million unpaid carers, and we have 41,000 members. That 6.5 million is from the 2011 census, so we are pretty sure that has risen significantly to our current estimate is around 8.8 million. But we also believe during the pandemic, a lot of people became temporarily carers, and that figure could have gone up above 13 million. And I work in the carer support team at Carers UK. We have a helpline, we have an online forum, we have lots of communications and events for carers. As well as volunteering opportunities for them. And during the pandemic, at the start of the pandemic, we started an innovative program of online meetups. We didn't know it would become a program. We started off with one online session, a wellbeing session for carers in April 2020. And we tried these things before, but had very few people coming along. But this one in 2020, we had 20 carers come along to that. So we knew we were onto something. And so from the month after that, we were running a couple of sessions a week. We're now running around 5 to 7 online meetups each week for carers. So we run Care for a Cuppa every Monday, which is a drop-in session for carers. And then we run what we call share and learn sessions throughout the week, where we usually have guest speakers and facilitators coming in to run sessions on well-being, skills development, arts, lots of other topics as well. And it's been great hearing some of the speakers today, who I will get in touch with to see if you'd be interested in coming and running some of those sessions with us. And Rotary Great Britain and Ireland has over 40,000 people of action who use their time, energy and passion to bring about change in their communities. So we really felt there was a natural synergy between our organisations, and it's been fantastic working with Cheryl and all your colleagues over the last nearly 2 years.
Thank you, Michael, and a big thank you to him for, I hope you'll understand in a minute why I begin with those words, thank you, because I'm a Rotarian and a carer. And you don't realise often that you are a carer till you ask yourself, could the person that you help live without your help? And so it took me a while to realise I was indeed a carer as well as a Rotarian. I was truly delighted when this partnership then was mooted, and when in my national volunteer role as head of humanitarian service for Rotary Great Britain and Ireland, I was able to be in at the very beginning of the partnership development. Not ideal in a pandemic, but you ask yourself, is that not an ideal time to be involved in a partnership? If you want to help more and more people, alone is not the answer, it's with others. So we knew we had shared beliefs and values, and I think that is so important. And they are very simply to help others wherever, whenever, and however we can. So if we look at the next slide, we needed to identify some aims of our partnership. We again kept them simple. We believe simple things are more easily delivered. So we said we wanted to use our network of Rotary, active Rotarians and clubs that range from Land's End to John O'Groats. Some of them are small clubs, some are very large clubs, some are online clubs and passport clubs. So we knew we had that infrastructure and we wanted to use it to reach out to as many carers as we possibly could, identifying them through our family networks, business networks, whatever we worked with. And the idea was the second aim, to increase individuals' awareness of the services and support that are freely available from Carers UK and other local organisations. This morning, I've been listening to other social prescribing speakers this morning, and it's very often that things are there, but people are not aware of them. So we thought in our small way, we could tell more people about the wonderful things available. And lastly, but by no means least, is connecting carers to carers. From personal experience, and I'm sure looking at all of you, you will relate to this, caring can be lonely, caring can be isolating, caring can be frightening. And there's nothing better than a peer group to share, to really share your experience, and it puts it in perspective. So what have we achieved then? This is the next slide. Please put this against the backdrop of a pandemic, because we didn't set key performance indicators. I know we should, but quite frankly, we were mightily relieved with anybody who came forward and anything that they did. So we remarkably recruited, it's actually over 150 what we call district leads and ambassadors. They're Rotarians. A Rotary Great Britain and Ireland has 25 districts covering the whole of Scotland, Ireland, Northern Ireland and Wales and England. We recruited 25 fabulous district leads who, as we speak, are still out there beavering away with their teams of ambassadors. And to support them, the second thing that we did, and it was that we had to do something different, we created learning materials, resources, we did online training covering safeguarding right the way through to communication skills, and we're still doing that. And we will gladly share with any of you the materials that we have developed, including the social media posts and the templates to be able to set up a memory cafe or to be able to set up a friendship group. And thirdly, because this is what it was all about, connecting more and more carers to services available. And we will never stop doing that. We will keep going, carer by carer by carer. And finally, and we are so grateful for today and Ingrid and her team, it's raising the profile of carers, from our very youngest carers to our very oldest carers. And wherever we have an opportunity to speak on a radio, local newspapers, etc., we gladly take the opportunity. Please spread the word. There'll be carers sitting near you who will not know what is available. So if we go to the next slide, it's our final slide, and as Michael is going to come back on and take you through that. Thank you.
Thank you, Cheryl. So for those of you who are thinking about developing partnerships with another organisation, here are just a few of the lessons that we've learned over the nearly 2 years we've been working together. So first of all, develop and communicate clear aims for your partnerships and really set out what you hope to achieve together. And as Cheryl said, we didn't have so many KPIs. We kept them quite minimal, but we really had that clear aims of what we were looking to do in raising awareness in communities all across the country, reaching out to carers and connecting them with that support. And focusing on complementary organisational goals. So for Rotary, Rotary are all about making a difference and making connections locally in communities. And one of our organisational goals is connecting carers so that no one has to care alone. So there was a very clear overlap there that we could home in on, and we focused on that common ground. Investing the time to understand each other's organisation. So early on, we spent quite a lot of time having joint online meetings, of course, to present to each other about what we do and really understand each other and get to know each other as well as we could. And then, if appropriate, to develop joint volunteering opportunities. I mentioned at the beginning that this partnership was instigated by a volunteer, and we've in recruiting the Rotary ambassador volunteers, we've been really careful to make sure that they feel that they're Rotary volunteers, but they're also part of Carers UK's volunteer programme as well. So they receive all the same volunteering resources that our other volunteers receive. They're invited to our monthly volunteer catch-ups as well. And lastly, being ambitious and grasping new opportunities as they arise. And I suppose an example of that is being here. We received an email from Ingrid and Wendy a month or two ago to ask if we'd be happy to come and present at this event, and we were really glad to be able to do so together as well. So Cheryl and I, we've been working together for nearly 2 years, but yeah, never met. This first time we've met a couple of hours ago.
I said, how tall are you? I'll wear a red dress.
Yeah. So that's been a lovely part of this morning, and another part of it has been, I mentioned our series of online meetups, Care for a Cuppa and Share and Learn, and really we were looking at how we know that we've had about 4,000 carers come to those sessions during the pandemic, but we know we're only scratching the surface. So really excited going forward to be engaging with NASP about how we can use social prescribing to connect with more carers, and through our partnership with Rotary, connecting our volunteers together in communities, and really excited about, as we emerge from the pandemic restrictions, that we get our community volunteering going, and I think for the volunteers it will become much more fun, and they'll be able to really feel that they're making a difference, won't they?
We're raring to go, aren't we?
We are. Okay, thanks everyone.
Thank you so much, Michael and Cheryl. It's always incredible to hear the story of that, because so much of it happens quietly in the background, but it really comes alive when you tell it. I'm not going to ask you questions. I'm going to move on, and we'll take questions at the end. One of the things that you mentioned, Cheryl, is that simple is more easily delivered, and innovation doesn't have to be complicated, is I think the message that I take from that. But I wonder, Brian, whether that's actually the case. And I'm going to now turn to you and say, do you want to tell us about the project that you've been working on in Somerset? So this is Brian Dow, Deputy Chief Exec of Rethink Mental Illness.
Great, thank you. It's quite an introduction to be called simple before you take the stage, but those colleagues who know me, and I think I've got one in the audience, a former colleague, will probably attest that that's spot on, actually. So lovely to be here. Thank you very much for inviting me. I mean, what you said earlier on, Ingrid, I think is absolutely right, that innovation doesn't have to be about widgety things, and this is very much not about this. This story begins, for us at least, when we thought about the most powerful weapon that anyone who works in the voluntary sector possesses, and it's this thing here. Are you familiar with it? The pointy finger, where you point your finger at government and you say, you should be much better at this, or at the NHS and say, you should be integrating better, or, you know, other charities, you should be doing it as well as us. And actually, really what you need to do with that finger is point it back in on yourself and say, what is it that we're doing? So let me just do a bit of audience participation if I can. Is there anybody in this audience who knows anyone in their social or family circle who has a mental health problem? Just a show of hands. Just have a little look around there. Pretty much everyone. So here's the second question. When that person that you're thinking of is ill, are they at their most capable of navigating their way around all of the support that they have? So show of hands if that's when they are really able to do that. No, exactly. It's a terrible ask to make of people that when their confidence, their capability, and even their capacity sometimes is so low that you're asking them to work their way around all of the different forms of support that they might need. And so that was that kind of pointing in moment where we think began to say, you know, what is it that we can do to help people get the support they need wherever they are? So next slide, please. That Chris Whitty moment, the anxiety one. Will it happen? So this was, and this is a brilliant moment where I forget I should have brought my glasses to these things, but so hopefully from memory. Two things were kind of going on. Firstly, the new investment in the community mental health framework. So essentially, record amounts of money going into help people who are living with a mental health condition in the community. And then secondly, our own organisation's movement towards a more kind of social model of mental health, which is not to say that the clinical care that all those people that you've put your hand up to identify isn't important. Of course, it's the most important thing, getting good access to quality care quickly and close to home, but all the other factors that make a difference to your life. So what is your financial situation? Are you in debt? That's going to drive difficulty. Are you in a stable home? What's your physical health like? Are you isolated from your friends and community? All of that and other things will have an impact on your health. So building on some work that was done in Somerset, and if we can go through to the next slide, please, we approached that area to talk to them about helping build their new transformation agenda. And if we can go to the next slide, please. There were a few principles for us in how we do this. And so essentially they were about the terms of engagement. This was not about us. This was not about Rethink trying to get more services. You know, I think that's sometimes the instinct, that self-preservation, that, you know, our job is to make sure that we're okay, and, you know, because that's good for our beneficiaries. Sure, of course, but there's a point at which you have to recognize you are part of the problem. And if it was just about Rethink getting bigger, then actually all we would have ever been doing is helping a part of somebody's problem. There would be no blame in this. So if things didn't work out, we'd start again. And we'd be really flexible about how we went about this. And fundamentally, it was about a different kind of culture, so that the voluntary sector, local authorities, and the local health system actually work in true and genuine partnership. It's not a kind of commissioning arrangement where you're told what to do and, you know, you go off and do it and very passively. It's actually about building the things that people need. So next slide, please. Those are some of the partners that are in it. You notice that Rethink is on there. It's in classic tradition, alphabetically, but we are the lead provider, but we are absolutely first amongst absolute equals. So it's a whole raft of different organisations who are participating in that. Next slide, please. And it's co-produced, and that's really important because it's a word that I'm sure that most people in this audience will be familiar with. But in truth, how often does it actually happen? We kind of pretend that we co-produce things, but we don't really, because there's neither the time or we've got other pressures. But that was some of the conditions that we set, that let's genuinely try to co-produce the support that people in Somerset actually want, rather than what we think they want. So go on to the next slide, please. Here are some of the key achievements, and I'm not really going to dwell on this because, in a sense, this is a kind of relatively narrow issue around mental health. And so I'm conscious that lots of people in this audience may not be mental health practitioners, but there are, you know, some very tangible, and bearing in mind this is only really 2 years old, some very tangible outcomes that demonstrate that it is working. So lower times for IAPT, no out-of-area placements, which is a pretty remarkable achievement in such a short period of time, and various other things. It shows that actually when you design an ecosystem based on what people need, and importantly, above all, I guess, is this open door approach. So regardless of how you come into the system, and I'm sure we all use the word the system, and we don't really know what we mean, because we mean a kind of slightly opaque collection of different things happening, regardless of where you are. So you might be, I don't know, you might enter the system because you've got a financial problem. Perhaps you've called a local financial service, but you're in. And there's that business of making sure the support that you need, you get to. You don't have to jump through referral hoops. You go straight to it. And there are people there whose purpose it is to make sure you get access to that. So next slide, please. So really, I'm just going to finish up by telling, giving some suggestions on what those key learnings have been. So the first is that point about relationship and trust. It takes patience. I think we've said earlier on that if you go alone, you go much quicker, but if you go together, you achieve much more. And it has taken a long time to build that trust, particularly in our case, as a big national organisation. There was an element of suspicion, and we had to kind of accept and understand and actually embrace that. So, you know, the patience, the trust, all of those things are kind of critical foundation factors, I think. Committing to co-production, which I've said, and keeping to that. So acknowledging that what it is that people want is what people actually need. We use this phrase a lot. It might sound slightly pompous, but I think it recognises that as a big organisation, you do have access to resources, sometimes that local organisations don't. So, you know, giving away what you've got, not thinking about yourself first, helping others to try to get to the same place that you've got, and indeed moving if you need to move. Talked about engagement and just being very conscious of the fabric of that local community. An effective procurement, I think you were just talking about it in the previous presentation, is being really clear about the outcomes you're trying to achieve. You know, often a commissioning spec is written in a dark room by somebody who themselves is feeling a huge amount of pressure and their limited budget, and off it gets sent, and you get lots of organisations scrabbling to do an increasingly difficult to provide service. This is about actually saying, let's start with the end first, what the outcomes we're trying to achieve. Next slide, please. I think I've talked about this kind of principles of how we work, that kind of no blame culture if something goes wrong, and making sure that we're building in that period to reflect. So what has succeeded and why, but equally, you know, what hasn't. And so I guess I'd end on that point. This whole kind of process, which we're now beginning to do in other areas with other kind of range of different organisations, is about its basic premises: don't be afraid of failure. So lots of things did not work. Things that we thought would happen didn't happen. There were moments where there were fallouts, frankly. But that things only really ultimately succeed if you're thinking big and you're getting stuff done, hopefully having fun along the way, if you're not frightened of failure. And along the way, we got lots of things wrong. But I think it's that confidence to come back, keep doing it, keep refining, that means we've ended up with what I think is probably regarded as one of the leading mental health innovations in the country. And of that, I must say, I'm incredibly proud. So thank you very much.
Thank you very much, Brian. And yes, absolutely, you should be so proud of that. A couple of the things that you mentioned are so important, I think. Definitely do not be afraid of failure. Failure is such a key part of innovation. You don't create new solutions to challenges without taking risks, and taking risks sometimes comes with failure. So definitely a message that we need to embrace, but also just the approach, the meeting people where they are and having an open door policy. Those are so essential to social prescribing and to a person-centered approach. So I'm sure you'll get questions and comments online as well from people on that. We'll move on to our last presentation. So Alex Birley and Jessica Santa from the SouthBank Centre talking about the partnership with NASP and others.
Thank you so much for inviting us to speak, and it is a pleasure to be hosting you all today. My colleague Jessica and I are here to share with you all some insights into SouthBank Centre's COVID-19 response project, Art by Post. a project that is rooted in partnership working. Next slide, please. SouthBank Centre is the largest arts centre in the UK. Our site consists of 3 concert halls, the Hayward Gallery, the National Poetry Library, and on average we present over 3,500 events a year, hosting 4.4 million visitors. Next slide, please. Just weeks before the first national COVID-19 lockdown, SouthBank Centre and NASP announced their new innovative strategic partnership, a partnership that would see 2 dynamic leading organisations in the arts and health arenas join together to collaborate on dynamic, forward-thinking and positive programmes to further cement the powerful relationship between the arts and people's health and well-being. Next slide, please. 2 weeks later, along with the whole cultural sector, we shut our doors, an unprecedented crisis. Simultaneously, the positive impact and essential role of creativity and the arts on people's physical and mental health and their sense of well-being was never more important or necessary. As you heard from our CEO earlier this morning, tackling loneliness and social isolation was already one of SouthBank's existing key strategic priorities within our Arts and Wellbeing programme, led by my colleague Jessica and Emma Nutland, our Arts and Wellbeing Manager. We were concerned that the pandemic was very likely to exacerbate the loneliness crisis already affecting 9 million people in the UK. Next slide, please. It was right at the heart of this first COVID-19 lockdown, forged in crisis, that Art by Post was created, a direct response to engage those most isolated by social distancing measures, and with a particular emphasis on reaching those older adults living with dementia and adults living with other chronic health conditions and their carers. In addition, this country experiences a significant digital divide. Many vulnerable and isolated people do not have regular access to the internet or smartphone technology, so it was important to us that our response was analogue. We will now share with you a short film that highlights some of the participants and partners without whom this project would not have been possible.
I knew I had to create stuff to keep above water. So I got involved with the Art by Post project. Each leaflet was completely different. It would give you ideas of things to do. Look at your room from a different angle, draw a picture of it, and asking me to try things I would never have tried before.
Well, when the lockdown first started, my day-to-day life was very meagre and quite desolate. Having received the first booklet, to have that basis to work from, and that nucleus, as it were, or catalyst, was inspirational and amazing, because it was a new way of working for me, having only worked out of my own head for so long.
They gave me ideas that I could use. And then I came into the shed and started putting all these bits of broken glass together. And before I knew it, I had all this collage of glass that I just needed to get out there.
My name's Simone Stewart, and I am Head of Creative Programme at the Barn in Aberdeenshire, and it was a real revelation when we found out about Art by Post. At that stage I was just like, there's something I can send to these people who we're in regular contact with to keep them creative. I'll always, I think for the rest of my career, will remember that, because I think it was strong, it was brave, and it was what was needed for the time. And I think what has resulted has been just such an amazing project.
Many older people, especially people living with dementia, aren't online. So to have this meaningful arts offering for you know, the people who use the Age UK Camden service for old people throughout Camden was just such a brilliant thing to, you know, in terms of actually really having a holistic package that looked at every part of someone's well-being and what matters to people in life. You know, it's not just the practical help, it's not just the, you know, the mental well-being and the social, it's actually the creativity and that sense of self-worth and self-expression, and, you know, that it all comes with it, you know.
So we were approached to be part of Art by Post, and it really fit into our strategy of supporting our communities during the lockdown. This really felt like a great opportunity to connect nationally, but also to provide activities and support for those who are socially isolated and the older members of our community in some of our classes and courses, and a really great offer, as well as the Zoom workshops that were already happening as part of Sunderland Culture's programme.
Art by Post came at a brilliant time. We were doing work that complemented already this work, but we knew that a lot of our communities, some of which are in the most deprived areas of the city and people who are very socially isolated without digital access, actually needed something that was paper-based, that was delivered to them, that came to their doors. And that's what Art by Post did. And we know that the project has been a brilliant success, and it came at such an important time for our communities.
Hello, my name's Bernadette Russell, and I am the creator of Journey to a Town Called Hope. My invitation to everyone and to myself is to let's hold on to some of those really beautiful and positive things that came out of Art by Post, the community that's been created, of the work that came out as a result of it, of the provocations, of the new friendships that have been made, of the new poets and artists and writers and thinkers. Let's hold on to that, and let's say we're going to keep doing this, we're going to keep writing, we're going to keep painting, we're going to keep talking, and we can be together in the world with love and with creativity, knowing that art has the power to change and transform lives for all of us.
I would like to say, don't be afraid to attempt something new, no matter what age you are. Be sure that if you look for new horizons, life will never be dull. Thank you.
So this is the lockdown window. This is the window that the Art by Post project has really given birth to.
Life is full of art. We tend to forget what is around us, all the things that inspire us and help us get through the day. We think they're just mundane things, but they're treasures. And I think as we value what we have, we begin to open up our lives. That helps to sustain me, and I think it helps people to get better.
What you have done in reaching out to so many creative souls, 4,500 I believe, it's such a powerful achievement. From however remote, near or far, you have made the South Bank a place for the people, not just for London. We hope this valuable connection will continue to shine for everybody.
Everything I need is here. These COVID times have made it clear. We need to look not far, but near, to find the things that are most dear. A kiss from him I love the most, the comfort of hot buttered toast, card in the post, a dream of visiting the coast. Fresh air, blue skies are here for all, and robin's song and blackbird's call. To sit outside with friends and kin, to feel the warmth of sun on skin. The thing to make me feel most glad will be holding hands with Mum and Dad. These COVID times have made it clear, everything I need is here.
Thank you. Hi everyone, I'm Jessica Santo, and it's really nice to talk to you about the project today. I think Dr. Rada said earlier that the best storytelling comes from the people telling their own stories, and we're so grateful to all of our participants who shared their stories with us, either on the video that you've seen there on our film, but also through the artwork that they shared with us to be part of the exhibition. So a huge thank you to our participants. I'm going to talk now a little bit about the partnerships that underpinned the Art by Post project. And as the project was quickly gaining momentum in sort of June, July 2020 in the first lockdown, the project was growing much quicker than we expected. At first, we hoped to recruit around 300 participants to receive the booklets every month. But before we knew it, we had 1,000 people, 2,000 people, and it just kept growing till we had 4,500 participants. And we knew we needed some partners and some support to hold that community that was becoming a really national community. So we set about creating a network of national delivery partners with organisations across arts and health. And I think I really liked what you said, Cheryl, that maybe in a pandemic when things are really hard is actually the perfect time to make these partnerships. And I'm sure, you know, somewhere in our logical brain, it was a very difficult time to do it when none of us could meet in person. All of those different organisations, all 13, were having challenging times with furlough and the pandemic and all the different issues we were all facing, but actually it was a hugely supportive network that came together. So if we can go to the next slide, I just really want to share with you who those people were. And you can see all their logos, but I am going to name them all because they were just all so fantastic and I really want to acknowledge their contribution. So we worked with Age UK Camden and Age UK Oxfordshire, with Arts Depot in North London, with Arts in Care Homes, which is NAPA, the National Activity Providers Association, The Barn in Aberdeenshire, Beacon Arts in Inverclyde, Dulwich Picture Gallery, Home in Manchester, King's College Hospital, Nightingale Hammerson, which is a care home in London, Philharmonia Orchestra, Platform in Glasgow, and Sunderland Culture. And we all came together to create this national partnership of delivery partners. And I'm just going to talk through some of the ways that we worked together. So one of the things that we hoped was that the delivery partners would be able to invite their own participants to join Art by Post. We knew that all of these organisations had huge communities that they normally would be serving and communities that relied on them. But in the pandemic, it was very difficult for organisations to be able to offer anything. But we had the resources to design and create the booklets. But most of our marketing and communications team were on furlough, so we didn't have the ability to create a massive kind of national recruitment campaign to reach more people. So we felt if we came together and if we gave, Brian, you said about giving what you have, what we had was these booklets, and we could give them free to these organisations and they could offer them to their communities. So by coming together, we could help one another, and that felt like a really strong thing to do. If we can move to the next slide, I can show you some of the participants as well. These are some of our participants. And we were able also to design the back cover of the booklets to make it bespoke for each organisation. So if you were a participant that were really familiar with the platform, for example, in Glasgow, it would have the platform's logo and would have their contact details. So there was a sense of familiarity about the booklets depending on where you lived and which organisation you felt connected to. And many of these organisations did recruit participants, which was wonderful. And just to give you an example, Amanda, who's on the slide there and you saw in the film, she came through Arts Depot. So Arts Depot were regularly offering matinees and lunch clubs for older people in their community and also to care homes. And they had a large programme of adult classes as well, and all of that stopped in a pandemic. So they invited all of those people to join Art by Post. And Amanda was one of those people that came forward. She really enjoyed the project. She sent her artwork back to us. And she's now attending sessions at SouthBank Centre as well as at Arts Depot. She's joined some of our workshops, some of the Zoom workshops as well that supported Art by Post. And even she gained the confidence to submit one of her stained glass windows to be included in the summer exhibition at the Royal Academy last summer. So a really great example of how we were able to reach different people. If we move on to the next slide. Another aim of the partnership was to be able to provide people with local support and signposting close to where they live. As much as we'd love all 4,500 participants to come to SouthBank Centre, obviously if you're living in Aberdeen, that's not very possible. So we really hope that organisations could provide that to their local Art by Post communities. And a really nice example of that is we worked with the Barn on one of our booklets, Growing Together. And since then, they programmed a Growing Together Day, where they invited their Art by Post community to join in to learn creatively about growing food, about eating healthily and seasonably, and sharing that knowledge with their community. And for the first time, they were able to meet some of their Art by Post participants in person. If we move to the next slide. We also really wanted the network to help us reach new artists. Art by Post allowed SouthBank Centre to continue commissioning and employing freelance artists during the pandemic at a time when many of those artists had lost all their work. So it's something we felt was a real strong strength of the project. But now everything was online. We weren't meeting any of these artists in person. It wasn't essential for any of them to be able to travel to London. So we used the national network to work with new artists outside of London on the recommendations of our partners. And we've got photos there of some of the artists that Home recommended to us. We worked with Cheddar Gorgeous, Samantha Edwards and Anna F.C. Smith, who all came together as a collective from Manchester, and they created the You Exist booklet that you can see there. And if we move to the next slide, Bibbo and Brian Keeley were recommended by the Barn in Aberdeenshire. They'd been isolating throughout the pandemic, so they had a real lived experience of what some of our participants were experiencing as well, and they created our Growing Together booklet. And if we just move on to the next one, I just really wanted to include this gorgeous photo of 4 of the different artists that created individual booklets for us. So Susie Lark, Shazia Qureshi, Bernadette Russell and Sewar Cunningham. And the event they are there is one of the launch events of the exhibition at SouthBank Centre, where I invited some of the participants to join us as well for a friends and family event. And it was the first time those 4 artists came together. And as you can see, they had a wonderful time and got on really well. So I guess another element of the partnerships was partnerships that might form between the artists as well that the project brought together. If we move to the next slide. Another outcome of the partnership was sharing expertise. We purposefully brought together organisations that represented arts and health and had different areas of knowledge and expertise to contribute. And we really felt that the partnership became really generous. Again, in this time of pandemic, when we really needed support from other people, this partnership became hugely supported and people were really generous with their expertise. So Gabby Garbett from Age UK Camden, who you saw talking in the garden on the film, she offered the whole network a session on dementia awareness. And Simone Stewart, who's also on the film from the Barn, she shared their knowledge and experience from the Barn about arts and ecology. So it was a very giving and gaining partnership. And if we move to the next slide. We're now currently thinking about the next stage of Art by Post and how we continue to serve the Art by Post community whilst all of those organisations are also returning to in-person activity in their homes. But we're continuing some activity in this time of planning because we really want to continue to support and engage that community. And one of the things we've done as part of the legacy and in partnership with NAPA, one of our delivery partners, is to create the Every Corner Network. This is a monthly online event for people working in care homes to come together to take part in a creative activity online that they can then go back and share in their homes. So these are people who are all really committed to making sure that creativity can exist in every corner of the care home. And it's a really great way that the partnership has developed onto new activity. So as I wrap up, I just want to say that we're really open to partnerships. We've really enjoyed working in this partnership. It's really fed the project and it's really fed us as professionals as well and as an organisation. So if any of you in the audience are sitting hearing about Art by Post and thinking there's a role for us to work together with your organisation, we'd love to hear from you. Alex and I will be here at lunchtime. Come and speak to us. Emma's here as well from the team. So do come and talk to us. We're really open to think about new partnerships and working together.
Thank you very much. Thank you very much for that and for showing the incredible stories on that film. And I do urge you to go and have a look at the artwork on the website. They're amazing, and they really brighten up our lockdown at the office when we got updates from SouthBank. One of the things I'm really struck by is how innovation during a crisis took both digital and virtual forms in the sense like Carers UK, Care for a Cuppa, but also these analog post projects as well. And I think there's not like one solution is the only one for a crisis, but the partnerships that run through were so strong and were so critical to the success. I wanted you to hear all of the stories, so we're running very much out of time in terms of questions. I'm going to just pick on one of you, I'm afraid. I'm going to pick on one of you to ask a question, and I'm going to ask Cheryl, what's the next challenge that you're looking forward to?
Right, the next challenge, obviously, I'm from Rotary Great Britain and Ireland, but we're part of Rotary International, and I know throughout the whole of the world, actually, there are carers. So we'd like to work very much and share the partnership model wherever we can in other parts of the world, using our Rotarians who are already there.
That's incredible. We're very much looking forward to, I have complete confidence in you being able to achieve that.
We should give it a go. We should give it a go.
We will hear more about global partnerships after lunch. I just want to go, and I'm aware that the online audience might not have had a chance to come in. No? Okay, great. Charlotte's just telling me no, they don't want to ask us anything. Are there any other last thoughts from the panel before we let people take on their lunch?
It was lunch.
No, I was going to say. Thank you so much for being with us this morning. Please do stay for lunch. We're going to be around to talk to you about all of our projects, and do look at the website and learn more about the Accelerating Innovation programme. We are recruiting members for the programme during March. And if anybody here wants to join, come and talk to me as well after lunch. And thank you so much to my lovely panelists.
Thank you very much to Ingrid and our panel. Ladles and jelly spoons, it is that time of the day. Before I let you go for lunch, just to let you know, there is a short tour of the Queen Elizabeth Hall roof garden being delivered by Paul, who's head gardener and founder of Grounded Ecotherapy. If you'd like to go on that tour, you can't all go because, you know, you'll step on plants and stuff. But there's a selected few. It's first come, first served. 12:55. If you can meet the SouthBank Centre's Creative Learning Manager for Arts and Wellbeing, Emma Nutland. She'll be in the foyer by the main entrance. Feel free to wave at everybody. She's down here. And we'll take you up there. It is first come, first served. There's limited spaces, but if you'd like to go, let Emma know. Other than that, have a fantastic lunch. We will see you back here we'll see you back here at 1:30. 1:30 when we'll recommence. Thank you very much. We are ready to kick off our second half of today's show. Have you had a good time so far? Yes. Brilliant. Show of hands, how many of you have learnt something you didn't know before arriving today? Amazing. I didn't come to learn, I'll be honest. I came to host and was sat there going, what? I've just sat back saying, oh my gosh, so it's been amazing. Hands up if you've had an idea you previously held, challenged, and you've adjusted your mindset on something slightly today. Beautiful, beautiful. This is what it's all about. And I take my hats off to any individual who can hold an idea, hear something challenging, and then make the adjustments. So beautiful. This show is doing exactly what it should be doing. Clap your hands. Come on! I've got faith in you. We can do this. Clap your hands. Raise your hands. Raise your hands. Beautiful, beautiful. All right, so For our second half of the day, we are kicking off with another panel. This panel is about building a global social prescribing movement. And with everything we've been through over the last couple of years, I can't think of a more important mission right now. So, if we can, try again on our numbers. Show me a 1. It's beautiful. Show me a 3. Show me a 5. Show me a 7. 8, 9, 10. Beautiful, beautiful. And perfect. This is where I need us to be, okay? So, the next chair I'm going to introduce is a gentleman named Bogdan. If we can please give Bogdan and his panelists a 10 out of 10 for their entrance. Feels like an 8. A bit more, a bit more.
Okay. Well, thank you so much, Kamal, for the energy. And I can see we've lost a few soldiers in the meantime, I think. The numbers are dropping a bit, but I'm hoping there will be a few more joining shortly as well. Hello to our wonderful international colleagues. I can see you. The audience can't see you just yet, but I thought I'll say hi. They are there. I promise I'm not crazy at the moment and speaking to random faces. We are going to be joined by some fantastic speakers from around the world up here on the screen shortly. But before we get started, I think the joy of today has really been seeing people in person, hasn't it? Realizing I needed to get actual trousers for the day and not just the blazer and the shirt. And I also realized I had to make my hair look good at the back as well, not just in front. And then one of you, I'm not going to name you, it's fine, saw me after 2 years and said I put on weight. How's your day going? But it's brilliant, isn't it? Just to see people in person and to have a fantastic lineup of speakers. I'm a medical doctor by background, quite a young one, so I wouldn't trust everything I'm going to say part of this panel, which is why I'm surrounding myself with great people around. Now, I also promise we've not chosen camps on purpose in men versus women. We will be joined by some fantastic women in social prescribing shortly. It just so happened that there's 3 men looking at you in the panel now, but we'll be joined shortly on screen by some fantastic colleagues from around the world as well. Brilliant. Well, today and at the moment, we're going to talk about global social prescribing. And I have the great pleasure of having with me James Anderson, who you've met, I hope, during the earlier brilliant speech. I'm not sure we can follow that up with another segment, James, but we'll try our best. James is the CEO for National Academy of Social Prescribing, and also great pleasure to introduce to you Gareth Presh, who is the CEO and founder of the World Health Innovation Summit. So here's what's going to happen. I'm hoping you bear with us without falling asleep, because I promise this is a great session to stay awake for. You're going to hear about opportunities to get involved and learn from and teach colleagues around the world. And I'm hoping we could generate a bit of a discussion at the end as well. What we're going to start with is hearing a bit about why we're crossing borders. Why is the UK trying to learn from others, not just exchange information from our end? We don't know it all, I think it's fair to say. And I'm sure I'm looking at our international colleagues and they're agreeing and nodding that we don't know it all. So I'll let them say what we don't know. We're going to look at international opportunities using a common language that Gareth is going to talk about in a second as well. And then I'm going to take you on a trip around the world so that we prepare for landing in some of those countries where you hear a bit about the narrative and the discussions that are being undertaken there. So, without further ado, I'm going to start my conversation with James. James, what's the common ground there? Why global? And why have we started looking at interacting with countries from abroad? What defines us all? What are the shortcomings?
Thank you, Bogdan. And it's great to be having the opportunity to talk to everybody again this afternoon about this. Firstly, Bogdan, I mean, I have to say, just to commend you on your global leadership in relation to social prescribing. You've just been an absolute inspiration, how you've brought people together from across the world, and we'll hear from some of those shortly, I know, but you've done an amazing job of really championing this cause and making it a realistic prospect of that join-up of countries from right across the world. So those of you that were here this morning for what I said will have in your head, hopefully, the reason why we need social prescribing, the challenges that we've got in relation to health and well-being in this country. But those challenges are the same around the world. Having worked in the NHS for many years, there is a real frustration when you go to different areas of the country and you're trying to roll programs out, and people say, yeah, but the people of Southampton are very different to the people of Sunderland. And, you know, there may be regional differences, but in reality, you know, as human beings, we all share very similar characteristics. And whilst regional differences do determine our health and well-being, actually, you know, the solutions for our health and well-being are exactly the same, regardless of where people are in this country. And the same is true in relation to international borders as well. And if you look at some of the global health challenges, they're very, very similar. Now, in many developing countries, they don't have the advantage that we have in countries where vaccinations are prevalent, where we've got clean running water, sanitation, you know, some of the foundations of good health and well-being. So there's more work to do in some places than there are others, of course, we know that. But actually, if you look at the premise for why we've moved down the road of social prescribing over here, that is exactly the same in other countries. People are facing loneliness, people are facing social isolation, there are issues with debt, there are issues with relationships, there are issues in terms of housing, quality, there are issues in relation to the resistance to biomedicine and the limitations of that biomedical model. And there are issues right across the world of demand on statutory services, on the pressures that are there in the system. There are also issues in relation to workforce. You know, there's a global shortage of doctors. So consequently, the circumstances that moved us in England and in the UK to move towards this system of social prescribing are absolutely prevalent right across the world. And it answers the question around why. What this gives us is a universal language. And the fantastic thing for me is that people I speak to in England and the UK around social prescribing, regardless of what that is, whether that's a faith-based organisation, whether that's a sports club, whether that's an artistic institution, whether that's the medical profession, everyone is united on this concept. It's something that really easily unites. And then you take that discussion globally, and it's absolutely fascinating to see how that same message is true, how what is happening today in Peru is the same as what's happening in Peterborough. The same challenges, the same types of organisations at a local and national level working to improve the health of their nation. And so wouldn't it be amazing if we joined up the whole world on this pursuit? And that's where the idea for the Global Social Prescribing Alliance came from.
Amazing. So tell us a bit about that, James, and then I'll get to Gareth to talk a bit about that international language. But in a nutshell, tell us a bit about the Global Social Prescribing Alliance.
So we recognised that there was such a movement across the country, and you're going to hear some pioneers now from your country, the world. You're going to hear from some pioneers shortly in other countries. We recognised that bringing everybody together, the opportunity to share knowledge and experience was just vast. And I learned so much from the Global Alliance. I talked to partners in other countries that are doing things that we never thought of doing over here. And it's like, yeah, we want to grab that. We want to pinch that. We want to progress that over here. And that sharing of knowledge and expertise has just been huge. Also, getting governments around the world interested in this, demonstrating that it's a truly global movement, is something really fascinating for politicians. And that creates some strength as well of why we'd want to move down this programme. So the Global Alliance has brought together countries from across the world. We now have 25 countries that are signed up to pursuing social prescribing practice. And we came together as National Academy for Social Prescribing, along with Gareth and the World Health Innovation Summit, with the United Nations Global Solutions Indexed Institute and the World Health Organization. And we said, look, what can we do if we bring our institutions together? How can we get other partners and create this truly global movement? And I think, it's a fantastic opportunity to really push global health in a very, very different way.
Amazing. And that's led to a true network of global partners from around the world that we'll talk about in a second as well. But Gareth, going to you to talk a bit about that narrative and that common language, because I guess our healthcare systems are different from around the world, aren't they? So then when we talk about that defining definition of what health looks like across the world, what could we use? And I know we were talking about sustainable development goals. So what are SDGs? What are sustainable development goals?
So yeah, I think this is about the opportunity for healthcare to move, as James has articulated earlier, but also to support the current system, because it needs a lot of support. I mean, we're short of 18 million staff by 2030 globally. So, in lower middle income countries, for example, they don't have the staff that we have. They're not in that privileged position. So how do we stop the disease actually developing so that we offset those costs occurring? And we really have a blueprint and an opportunity through the UN Sustainable Development Goals, because we had 193 heads of state stand up and sign on to a declaration to say that these are the blueprint and we're going to implement these goals by 2030. So that's what we're working towards. The key aspect for us is SDG 3, which is good health and well-being. And thankfully, through the World Health Innovation Summit, I just was commenting outside there in 2015 when I launched the World Health Innovation Summit in Cumbria and Carlisle. I would have loved to have had the National Academy of Social Prescribing to link into, but I didn't at the time. So I had to prototype how we could move the dial to prevention, but also demonstrate the value proposition. So how do you make it, as it says, impact? How do you collaborate? And how do you make it evidence-based? So that's what we did for 3 years. And then we had the opportunity, I was invited to Geneva to speak at a conference. And I fortunately had an opportunity to meet with the UN Director General Michael Muller's senior advisor, Roland Schatz. We had a 10-minute conversation and we had a follow-up Zoom, and he asked me to join the UN GSII Foundation, which was tasked with implementing the 17 SDGs in cities around the world, and to identify SDG projects that we could invest in that would actually bring value to the local mayors. So we're doing that at present, and where the opportunity is for social prescribing from an SDG 3 perspective is, as we've seen this morning, and it's been so well demonstrated, even from the woodwork, archaeology, everything, it touches every sector. We can replicate that and bring it to lower middle income countries, so they don't have to invest in, they will of course have to invest in hospitals, but they won't have to make that big investment in every single city. They can learn from our mistakes and look at prevention, and also create millions of new jobs. Remember, there is a lot of investment in the city program. There's no shortage of funding. I mean, if you go to any of the conferences around UN Habitat or World Urban Forum, you'll see that the finance is there. I'm also glad that you mentioned the faith groups, because they're going to play an enormous role in this. We're partners with the faith groups. I'm a member of Pope Francis's COVID Vatican Commission, and we have an opportunity now to go across all sectors and show that there is a value in the Global Social Prescribing Alliance. And colleagues that we've had the pleasure of working with before, Shane and others and Kate around the world, are doing the same work, but they need our support. We all have to work together. We all have to show and demonstrate that evidence that we talked about, so that we can change the policies and drive the investment into this. Because you can see just from the woodwork project, for example, how many times would those individuals have gone to their GP in a week? What would have been the cost of that? So there's huge opportunities in this space.
Absolutely amazing, Gareth. Thank you very much for that. And I think moving the conversation a bit away from the policy angle and looking at on the ground delivery of the services, and we'll talk more about the opportunities, I think, for countries across the world. I really want you to get a bit of a taste of the global social prescribing network of partners that have been growing across the world. So what I'm now going to do is I'm going to invite on screen some of our wonderful partners from across the world. And I'm hoping you get to see them. And yes, we can see you. Give us a wave, all of you. Hello, and the audience is waving at you, although I'm not sure you can see them. You probably can see just us, so I do bear that in mind as well. Okay, well, now we're gonna do one of those things where it goes cabin crew prepare for takeoff. And we're going to land in Australia. And I think I landed this morning already in Australia, because at 4 a.m., Sean will know I did already a talk for some of the Australian partners. Now, Sean, a warm welcome to you. And I have 2 questions for you and a third one potentially. My questions to you are, what does social prescribing mean to you? And what does social prescribing bring to Australians? And the third question is to really tell us a bit about what time is it there now? Because we're really curious.
Well, I'll start with the last question because that's the easiest one. And hello, everyone. Really nice to be here. So it's 12:30 in the evening here. So it's we've just turned over midnight. And that's the nature of our social prescribing global community. We were having a smile as we were talking, is that we're so committed to the movement and the cause and to the collaboration that we're very happy to pitch up at any time of day or night, just like yourself, Bogdan, sort of pitching up first thing this morning at 4:30 a.m. I think it was in Australia for you. So good day, everyone. So I'm an Anglo-Australian standing here 10,500 miles away from you all, and really delighted to be presenting on the subject and the global reach of social prescribing. And before I start, I'm based at the University of Melbourne, but obviously dialing in tonight from home. I'd like to acknowledge the traditional owners of the land from which I'm presenting my evening, and that's the Boonwurrung people and their elders past, present and emerging. So my background is a UK trained pharmacist. I'm also a public health researcher. And to answer your first question, Bogdan, what social prescribing means to me is a very tangible way of realising the vision of the World Health Organization, definition from 1948, believe it or not, that health should be a state of emotional and physical well-being, not just the absence of illness. So I think for me, studying public health and understanding that underpinning Health for All, set out in 2000, it's just terrific to see community and primary health really bringing to life the Alma Ata and the Astana declarations. And I think moreover, just as you've been talking about with Gareth, we're very well aware of how all this connects up so that each of us can contribute and deliver towards the Sustainable Development Goals. So there's something tangible that we can all do. And on the subject of health systems, so I think that's what's really interesting for us working as a group together. Delia and I had a chat the other day about the US and Australian healthcare systems, and also we've got a common denominator in the UK health system. So there are many similarities between the health system here in Australia and the one in the UK, but there are also a number of differences. And I think to your point, James, in terms of what's the transferability of social prescribing, this is what starts to make this really interesting globally. So the Australian health system is operated by both Commonwealth as well as state and territory jurisdictions. And in addition, we have a public and private health system here, so it's a little bit different to the UK. But similar to the UK, a general practitioner is the usual first point of contact, and then we have an onward referral system to other levels of care. And just to give you all a bit of a background about where the journey started for us, and the genesis was the UK, but it was the Consumer Health Forum here, together with the Royal Australian College of General Practitioners and Macquarie University, who highlighted the opportunity for social prescribing at a roundtable in 2019. And it was this and other collaborations, such as with Anala Health, IPC Health, Neighbourhood Houses, that have stimulated the activity here today, and a very strong collaboration across health, academia, social care and not-for-profit sectors. So, whilst there's no centrally coordinated social prescribing body here in Australia, there is a very strong national coalition. And for example, a community of practice set up through the Australian Disease Management Association in early 2020 is now well over 1,000 people nationally. And for all of us, as we've gone through the challenges of COVID, both globally and locally, this community has formed a highly collaborative central hub, and it's kept the connectors connected and very motivated in terms of sort of that, I guess, togetherness as we've all worked through the pandemic together and supported each other. There's a strong interest here to move to a national model, and a growing impetus has been fueled by the recommendations for social prescribing, to James's point about sort of government and policy. So we've had recent royal commissions into mental health and aged care, as well as Commonwealth and state policy recommendations through the Primary Care Task Force 10-year plan and the recently released National Preventive Health Strategy. So many of you may know that Australia is also going through sort of long-term health reform, maybe a year or two sort of later than the UK, but nevertheless the same type of approach and the same type of reach in terms of breadth and scope. So what I would like to say on this public stage is what we have seen and felt through the social prescribing movement globally is a vibrant and generous sense of community. Without embarrassing the people on the stage, I'd like to acknowledge the wonderful and unfailing support we receive from James, Bogdan, Michael, and those of Bev, Marie and Gareth, and the support and collaboration we have with our international partners, and that's Canada, Singapore, USA, the Netherlands, Ireland, Finland, Portugal, Sweden, Japan, and a number more. And I'd like to close by giving you a very tangible example of how this collaboration works in action. So a year ago, Australia launched the Social Prescribing Student Collective. This was built on the UK Social Prescribing Champion Scheme, and it was thanks to the guidance of Bogdan, Daisy and Joel, the leadership of Grace Newman, who's an MD MPH student here at the University of Melbourne, and collaboration with Australian Medical Students Association. Well, this group now reaches across 19 medical schools in Australia.
Wow.
And it's been a terrific effort in less than a year, and a significant step in building that capability of future health workforce that Gareth talked about, in a focus to reinforce the WHO vision. So Bogdan, thanks again for having us involved today. Very happy to dial in whatever hour, and for enabling you, James, Gareth and the rest of the team, this enriching and exciting global community.
Wonderful. Thank you ever so much, Sean. And I think that's a superb example of how we operate. 11 a.m., 12 a.m., 5 a.m. I think people will tune in, and everybody knows we do this out of passion and because we love working with one another. And that's what social prescribing is really about. It's always been a reflection of its people, and I think that's how it started in the UK, and that's how it's going to go across the world. So I thank you wholeheartedly, and thank you all especially as well. But we're now going to take a short trip to Canada, and we're going to hear from Dr. Kate Mulligan. And I know some of you may know Kate already because she's been involved for a number of years. Welcome, Kate. Tell us what social prescribing means to you and to Canadians. And I guess the second bit, what does social prescribing really bring to Canada?
Thanks, Bogdan. And I will share that it's 9 o'clock in the morning here in Canada, and I've just seen my 3 young daughters off to school. And I'm always very happy to spend time, any time of day or night, with this wonderful group of people. There is a real sense of belonging in this international social prescribing community, and I think it speaks to the passion and drive that brings all of us and all of you in the room and all of you listening online here today. So I'll say hello from Canada, and bonjour and anin. And I'm speaking from the city of Toronto, which is the traditional territory of the Haudenosaunee, Anishinaabe, and Huron-Wendat people. And today, of course, it's home to many Indigenous people from across Turtle Island, North America, and the world. And so here in Canada, social prescribing is not yet occurring at the broad systems level, but it's cropping up all over the country based on the enthusiasm and will of local people. So we're a very large and very diverse country. We have people from all over the world. Most of us live in big cities, but we also have many rural and remote communities all across the large territory that we cover. And each Canadian province and territory has its own distinct people, its own distinct geography, and its own health system. So the health systems are run at the provincial level, not at the national or federal level. So sometimes that can make it pretty difficult to do something that's truly nationwide. But as I mentioned, it is happening all across the country as we are sharing information one-to-one and in larger groups and in larger networks and associations to start figuring out and supporting each other to find out what works in our local context, what is the same and what might be different across communities or provinces. And social prescribing here in Canada has long had a particular focus on health equity and on the leadership of those local communities. So most social prescribing to date has been led not by the healthcare system, but by community organizations. So pan-Canadian community organizations such as the Canadian Red Cross and the United Way Centraide Canada, or by primary care teams of interprofessional workers that might be called family health teams or community health centers that have been leading the way. And in fact, I'm very proud to say, we're the first winners of the International Social Prescribing Network's award for the best international social prescribing scheme back in 2019. And sneak peek, there is another winner of the best international social prescribing scheme on our call today as well. We do have some hospital-led social prescribing that has started to emerge here in Canada as well, but it's tended to focus more on the material determinants of health, so meeting people's needs with respect to food or housing or income and those kinds of things. And we do have many projects that might have different names, but are quite similar to the work of social prescribing that we're starting to bring into the fold. So this might include Indigenous-led healthcare or Afrocentric healthcare that are centering culture as medicine and really working to recognize the impacts of colonialism and racism as drivers of health inequalities. For me, the most meaningful part of social prescribing is seeing individual people and communities rediscovering their sense of purpose and their sense of meaning and their sense of belonging and connection to one another. So we still have a long way to go here in Canada to really center that sense of self-determination and the work of preventive healthcare in our health systems. But all these examples that are coming up, all the way from British Columbia to Newfoundland to Nunavut, show that we have growing momentum. And I'll just leave a little hint that next week on Social Prescribing Day, we will have an exciting new announcement about how we're starting to knit those small initiatives together into a new national initiative.
Thank you so much, Kate. And we're not talking more about that because we're not spoiling any news there. But tune in on the 10th of March to hear about that. And you might have noticed we're not going in depth with the models of social prescribing here because, as you all know, we have a follow-up session that goes very in depth at the Social Prescribing Network Conference on the 10th of March as well. So the same team will be there going in depth and looking at how this is happening across the world, hence why the speakers are giving you a broad overview as well. Conscious we're running out of time, so I need to keep telling myself this. But now we're taking a short or a long trip to Singapore, really. We have Dr. Lee joining us all the way from Singapore. And it's a warm welcome to you, Dr. Lee. And we look forward to hearing what social prescribing means to you and people of Singapore, and what does it bring to you all?
Thank you, Bogdan. And I bring greetings from the social prescribers in Singapore. What does it mean to us? As you know, I am a GP working in a hospital. It's something not so common, but it happens in Singapore. And most of the time, we get very frustrated because the medical prescription that we give falls apart. Something is missing, and we need to bring health and social care together. So social prescribing really completes the picture and, contributes to this overall care plan that's likely to be more effective. So what happened is in Singapore, we are a city-state. We have a very well-organized healthcare system, highly efficient and very cost-effective. But we are worried when we look into the future because Singapore has one of the fastest aging population in the world. And we are always looking for big ideas and new models of care to improve our system, especially to future-proof it into the next generations where the population is getting older and older. So we learn about social prescribing and best practices from colleagues from the Social Prescribing Network in the UK and from the Global Social Prescribing Alliance that was formed shortly after. So we thought this is probably something we should really go into. So we formed a project team, and we decided to come to UK in 2019, which I think we met many of the pioneers in this area. We visited a lot of the social prescribing pilots, and we also attended the second International Social Prescribing Network Conference. And we heard from the early adopters of social prescribing from many countries, and we are really inspired. So what we found was everyone was so nice and collegiate and so willing to share their experiences. So I think we really see the potential of social prescribing as a model of care that can really improve the healthcare system. In particular, I think it is a very sensible and well thought through framework that can shift the focus of care from the hospital-centric model back to the community where it should belong. And it allows us to expand the focus beyond healthcare and adopt a more expansive definition of health that includes the social determinants. So when we went back and to get the most bang for the buck, so to speak, we decided to adapt and implement social prescribing in a setting that is most likely to have the greatest impact on our healthcare system and to help a segment of our population that have the greatest needs for social prescribing. So after consideration, we realized that for Singapore, this setting lies in our secondary care system. So we have a system of what is called community hospitals that provide care that is focused on rehabilitation and care continuity of our patients when they return to the community. So this, we feel, is a very ripe area for social prescribing. This segment of our population likely to benefit the most because they need a longer runway to recover, which is why they cannot go home straight away and need to spend time with us in the community hospital. And they usually have less optimal social determinants of health. And they tend to be patients with complex health and social care needs. So then our strategy was really to build social prescribing into the medical prescribing plan. So while they are recovering in our hospital, so following the principles of implementation science, we have to define the components. So we said, okay, we should screen the social determinants of health, develop a social prescribing plan as part of the overall clinical plan, and engage the patients in social activities while they are staying in our hospital. And then on leaving our hospitals, we link them to the community assets near their home, where they can continue to be engaged in these activities. So off we go. We went to recruit link workers. We developed a competency-based training program. We organized staff engagement sessions to promote social prescribing through our organization. Now, our staff in the community hospitals are sort of self-selected. Otherwise, they would not be working in community hospitals. So they are community-oriented and they are very patient-centered. So, they get it very fast. They understand the value of social prescribing. The main challenge we had was how to integrate social prescribing into the work processes of the very busy clinical workflow. So through lots of ups and downs, we are reasonably successful. So now from one hospital, we have spread to 3 community hospitals in our group. And it's spreading beyond the community hospitals. Very happy to say that now we have begun social prescribing in our primary care clinics in our regional health system as well. And working with international contacts such as the WHO Western Pacific Regional Office, the Global Social Prescribing Alliance, the National Academy of Social Prescribing, and the Social Prescribing Network, we are supporting the spread of social prescribing to other countries around Singapore. So this is indeed a global movement to improve health and well-being. And I'm, like all the other speakers, I'm really very appreciative of our colleagues. So we are all working together across borders, in a spirit of promoting mutual understanding and making our world a better place where people can live in peace and experience good health and well-being. I think this is something that's really, really basic that every human being should be entitled to. So thank you very much for inviting me to this social prescribing show.
Thank you very much, Dr. Lee, and we're so pleased to hear from you. And now we're taking a short trip to California, to Delia, who's co-leading the social prescribing network in the US with Dan, who can't be here with us. Delia is the one that we're usually jealous on because of the sun in the background in California usually. So Delia, over to you, and tell us a bit what social prescribing means to you, to the US, and also what does it bring to people in the US?
Thanks, Bogdan, and thank you so much for the invitation to join this conversation today, all the way from Los Angeles, where it's just after 6 a.m., so you might be able to see the sunrise coming in behind me. And I must say, it's great to be back at the SouthBank Centre, even if it's just on a virtual screen and not in person. I'm really excited to be part of this session today for 2 key reasons, really. The first is due to my involvement in some of the social prescribing work in England over the last few years when I worked at Sport England, and really seeing this movement develop and continue to grow, and working with many of the partners who might be in the room today. And now having the opportunity to look at social prescribing within an entirely different health system context in the United States. And the transition from a national public healthcare system in England to one that's a mix of public and majority private health insurance and providers that supports over 330 million people across 50 states has been quite a change, especially because there are some really big challenges which face our health system in the US, which we also heard from James earlier in the session. 30 million people don't have access to health insurance because we don't have universal healthcare coverage. We also have the most expensive healthcare system globally, with our spending reaching nearly 20% of our GDP. And despite this spending and cost of care, we actually don't have better health outcomes and have significant health inequalities. So that brings me to the second reason why I'm really excited to be here, because I can really see the opportunities that social prescribing brings to the US, not only from a health system delivery perspective, but also for individuals and for communities. And while there isn't a formal policy or organization that's really driving social prescribing forward in the US, there is a lot of activity happening in pockets across the country. They might have different names, but they have the same principles of person-centered, integrated care in partnership with the community. There are community health workers who act as a link between health and social care services to help facilitate access. There are really strong advocates and supporters across frontline clinicians and community partners who not only want to treat disease, but also improve the social and the economic conditions that make people sick in the first place. And a lot of the work in the US has really stemmed from the very clear evidence of the social determinants of health, and really the need to look across different sectors and into the community. And following the introduction of the Affordable Care Act, there's been some really great innovative thinking about how we can do this. The Center for Medicaid and Medicare Innovation is really driving the momentum towards better integration of our health and social care systems. And they've supported some demonstrator projects across the US, looking at social risk screening, referrals into community resources, and community navigation pathways, which I think provides a really great foundation for us to build on. But there's still a lot of work to be done. So it's really great to have the opportunity to learn from and really collaborate with partners from around the world who share this ambition in creating a global movement. So thank you.
Thank you very much, Delia. And I think you can all clearly see that regardless of what this group ends up being, who gets involved, it doesn't matter. It's people getting in touch with each other, collaborating, making connections, making meaningful relationships happen across the globe, so that you can match community groups from one area in a country across the border, and to realize that it's all about people who can champion this from a grassroots, and then with support from governments across the world, we can make change happen, so that we completely change that definition that all of you rightly spoke about in terms of what we think about when we say health and healthcare in general. So a round of applause for our international partners for joining us today. And a huge thank you, of course, to James and Gareth joining us in person. And here there's lots of conversation that I'm sure we can have at some point as well. I think we can also take one question, because there's something exciting that you'll hear about, which is the evidence behind social prescribing, that I will be introducing some some brilliant colleagues that you'll hear from in a second, and we'll invite them on the stage. But before I do that, I think you need to be energized for that a bit, I think. And I think it's only right we do that. You've been sat there for too long, and I don't have Kamal in here. But I think what we could do is, if we put the lights a bit on so that we don't feel too sleepy, and if we do some shaking and moving around, if you don't mind standing up for a bit, that would be brilliant. And I don't have Kamal's energy, so bear with me, please. That would be brilliant. Amazing. Okay, let's move our heads a bit around. Fantastic. Oh, this is very good. Believe me, I'm doing this for you, but also for me, I promise. And then shake your arms and legs for a bit. Okay, brilliant, fantastic. I'm also getting you ready for the 10th of March. because it's Social Prescribing Day, right? So who knew about that? Let's see. Say woo. There we go. And you can hear that. So I want you to know, those of you who are link workers here, you're standing, the lights are on, and I'm gonna get a bit emotional because social prescribing has become a family for me. The reason I'm becoming emotional is because I've got involved when I was a medical student. And what I'm about to say as I look you in the eyes is that, and this is coming from my heart, if it wasn't for social prescribing, I would quit medicine and never look back. I'm gonna say that again. If it wasn't for you, for the link workers, for the social prescribing, I would quit medicine and never look back. Because in 3 months of working in the A&E department last year during COVID pandemic as a doctor, I spent 45 nights out of 3 months feeling burnt out. Not because I can't mount on that work, but because I'm disappointed. Disappointed I cannot provide what the individual in front of me needs. Disappointed I'm patching them up and I'm plastering them up and I'm bringing them in through a one in, one out door. And I'm spending 10 minutes to see them and give them another bloody drug that won't do anything for them. Disappointed I don't get the chance to look them in the eye, smile, cry, be sad, or whatever's happening because I have to complete the admin behind. Because I don't have time to connect with them on what truly matters to them. And because I only scratch the surface, because the definition I was taught was that I need to focus on the muscles, the bones, the biomedical problems, because there's no time for anything else. Of course there isn't time. Because our approach to this hasn't been right from the beginning, has it? Google healthcare, you will see, still says on Google the absence of disease in the dictionary. 1948, Sean said, the definition of health by WHO, we're not there yet, are we? We're still not understanding that what keeps us well starts at home, starts within our local communities. And then we look at medical experts, which I'm not, by the way, but I'm in a hospital and people come to me and we think they're broken already and we need to stick a plaster on them and send them out again with no support at home. People put those faces masks up and say, it's fine, we're doctors, we're the heroes that you're clapping for. We're not, we're burned out. And if it wasn't for social prescribing, if it wasn't for link workers, if it wasn't for you to provide for me the hope that I know you're going to listen to that person, which is what the reason was when I got into medical school for, to provide them with emotional, financial, well-being support within their community, I would quit medicine tomorrow and would never look back. So from that, I thank you from my heart for everything you've done. And that's a true thank you for the family that social prescribing has become for me over the years, that all of you have become for me. And it's again a coming together of people from all walks of life to change the definition of health for once and for all, to make social prescribing as exciting as bloody stitching for the future of generation of tomorrow. Let's do that together. And with that in mind, I will introduce some fantastic colleagues who are going to talk to you about the evidence, and we're going to clear the stage because they have an announcement to make. And we'll see you on Social Prescribing Day, aren't we? Fantastic. Can we get a happy Social Prescribing Day for the 10th? 3, 2, 1. Happy Social Prescribing Day. Fantastic. That was a good rehearsal. I'm sure Kamal will do more later, but that's fine. Okay, brilliant. Thank you so much, all of you. And I would like to invite on the stage now Dr. Marie Poli from the Social Prescribing Network, Dr. Anne Hunt, and Dr. Helen Chatterjee, who've all been, of course, fantastic mentors of myself, but many of the people in the room who will share some exciting evidence announcements for you. And I did say we didn't set ourselves in camps, but we kind of did, didn't we? It kind of is men versus women, but I will leave the floor to them. Thank you so much for being here, all of you.
Thank you so much. I don't know how I followed that, Bogdan, really. I'm super excited to be here. My name's Anne. I'm from NAS Evidence Programme, and I'm delighted to be joined by Dr. Marie Polly and Professor Helen Chatterjee. I'll let them introduce themselves properly in a minute. We've got 10 minutes. That's all we've got. So Bogdan, do shout at me if I run over. So all this passion we've heard today, we're evidence people, but we're just as passionate, aren't we? And we are desperate to make social prescribing thrive. We all need evidence every day, whether it's to, a quick qualitative decision right the way through to the UN making big policy decisions. We need evidence of some shape. And NASP is committed to help everyone involved in social prescribing find that evidence that they need on that day-to-day basis. So we've put our toe in the water, and we have our secret weapon, or our engine room behind. We have two actually, behind what we do. And one is we've established an academic partnership, and they work collaboratively to help us create and articulate a collective, independent, authoritative view of what the evidence is telling us. So it's not us just giving our view, somebody else giving their own independent view. It's a collective view, and that is incredibly powerful. And the other thing that we've built around that is an international evidence collaborative that, again, we hope will inform our work and also help serve the evidence needs of our international colleagues and the Global Social Prescribing Alliance. So I'm going to hand over to Marie and Helen. They're going to tell you a little bit more about what we've been doing together and how it's felt for them. And then we will come back and say a little bit more about what's happening next.
Thanks very much, Anne. And just saying hello to Delia and Sean and Ken Hoch and Kate. It's lovely to see them again from afar. So thanks very much, Anne. I just have to respond to that, Bogdan. So people thought I was like slightly bonkers when I set the network up in 2015. And this is my first outing in 2 years. I had to get the backpack off the wardrobe to find a dress to even put on. And sometimes when you're on your own for 2 years trying to push this forwards, it is quite hard. So when I hear Bogdan speak like that, I feel like bursting into tears, because I feel so grateful to hear how much it's impacted on people, and it's a collaborative effort. And I also have to thank you for waking everyone up before we talked about evidence. That was really kind of you, because quite frankly, evidence, sometimes people will switch off because it's beyond your scope, or it's not what you're doing, but we all need evidence. And when I set the network up with Michael, probably the most frequently asked question is, what's the evidence? What's the evidence? What's the evidence? And we've written a lot of evidence briefings and done a lot of work with senior leaders, but evidence comes in all shapes and forms. Bogdan's just given you some amazing testimonial evidence, but we need evidence to inform how our link workers can work as efficiently and effectively as possible. We need evidence to persuade commissioners that they need to invest in the voluntary, community, social enterprise and faith sector to prescribe the social prescriptions. We need evidence actually to inform how policy needs to shift and how curriculums need to change. And we need evidence actually to share how our global colleagues set up social prescribing, and that becomes a knowledge share because they can give us evidence. So that is really, really important. So what we've been doing is bringing core academic institutions and organisations together, really to share our expertise in saying, how do we systematically look at all the different types of evidence? And for me, it's really important that we hear about evidence that's some of the reports and evaluations from all the different organisations, because we have to make sure everybody's voice is heard, and we have to understand the full and true impact of social prescribing, not just how many GP appointments it saves, and not just how it changes mental health, but actually how it changes all aspects of our life and how that implicates on our well-being. So we have set up a deliberate collaboration, because actually the research sector is as competitive as it is to get funding in the voluntary sector. And we made a deliberate decision to collaborate and not compete against each other for the research money. So we have a core partnership of 7 institutions and organisations, and we work with lots of different stakeholders to say, what does this evidence look like? So Helen, let me hand over to you.
Sure. So, well, I'm not going to tell you lots about our methods because that would also be really boring. But what I wanted to say is that we've been doing a very realistic, pragmatic, but rapid scoping exercises over the past couple of years. We use a whole range of different types of evidence, from peer-reviewed literature to grey literature, and that's where you guys come in. I'll tell you a little bit about so far what we've been doing. We've been doing reviews around things like, for example, what does the evidence tell us about measuring outcomes? What does the evidence tell us about how does social prescribing help tackle health inequalities? Currently, we're working on reviews around nature and nature connectedness in health, how arts and culture and creativity support health. We're doing work around social prescribing in children and young peoples. But what we really need is to understand from you guys, what kind of evidence do you need? And also, what kind of evidence are you involved in producing? So this is really, I think, as we start to wrap up, is a call to arms. You're going to hear about the International Evidence Collaborative. There's already 260 members of the collaborative from 12 different countries. We really welcome anybody joining that who's interested in evidence. It might be that you're involved in producing evidence, maybe you're involved in doing evaluations, or you're interested in becoming more involved in evaluation, or you have to use the results of those evaluations to inform funding or strategic decisions you're making. So please do join us and tell us what you think is important to you in the types of evidence you work with. There's an event on the 29th of March where you can come and join the International Evidence Collaborative. You can meet others who are involved in it. That's done by AirMeet, and it's just a great opportunity to share your thoughts. And we'd really like to work with you more in having more of a two-way conversation about how we build that evidence base and then how we translate that evidence base going forward. So I'll hand back to Anne because she can tell you more about how you can access that. You can access the International Evidence Collaborative and join it via the NAS website or the Social Prescribing Network. And actually, Marie, did you want to say a little bit about the evidence repositories on the Social Prescribing Network? But do join us. We'd love to meet you.
Yeah, I mean, it's great to hear from everyone, and actually we can't do the right evidence reviews if we don't know what reviews you need, first of all, so we need your voices. So on the Social Prescribing Network website today, Start Social Prescribing Week, we've launched a database. It's a free, the world's first free open access database of grey literature. So that's all the evaluations and reports that are being put out about social prescribing that aren't systematically archived anywhere else. And they have a wealth of information in there, and they capture some really niche areas, and actually they really have all those different voices which must not be lost. So if you've got a report that you've been working on with your organisation, you can actually now submit it through the website and we'll put it on, and every few weeks we'll update. So there will be, you know, gradually hundreds, and this is just always there for you to download and use. So help us put that database together. Come to the event we've got for the International Evidence Collaborative, and can I hand over to you to wrap up?
Yep, hopefully on time, Bogdan. Yeah, it's just to put another shout out for Social Prescribing Day on the 10th, because we'll be releasing the first tranche of our evidence summaries, so the first 6, plus, so that's the academics review and collective view of what the evidence is telling us in the 6 priority topics that were picked. And then also we've got some briefings for people that might be a bit more rushed and have to just grab the headlines quickly. So that's happening on the 10th. Keep an eye out on the website. And on the website, you can also join, as Marie and Helen have said. So look to the NAS website. You can join up to the Evidence Collaborative, and you can also find the evidence summaries from next week on the 10th. And we want your feedback on them. So it's toe in the water. We'll get better at translating. That's the other thing, is translating the information into products that meet your needs. So thank you very much for your time.
Have you had a good day so far? Beautiful, beautiful. I've got some bad news. This is the final panel. That wasn't convincing. Good, do better. Try again. I've got some bad news. I like that. Yeah, I like that. Last time. I've got some bad news. This is the final panel. I know. And the only saving grace is knowing that this is the beginning of Social Prescribing Week. That helps. That helps. And knowing that there's something else coming on the 10th of March, that really helps. There's something on the horizon. Now, before we bring them in, I know you've been here for the majority of the day, you're doing really well. You online, you're doing beautifully. I think we had just under 200 people online, which is beautiful. And yeah, give a round of applause for making the trip to all the way down to the kitchen in their pajamas. I love it. I love it. But genuinely, thank you so much. You've made this event so enjoyable with your energy as well. I cannot explain how important your role has been. I have done events where you've come and said, good morning. And they just look. And you're like, oh, we've got a long day ahead. Your energy has been absolutely wonderful. Even the Tottenham fan. It's been beautiful. So, for our final session, it's about unleashing the power of local communities. And I would like to welcome to the stage our chair, who is the head of the Thriving Communities Programme at NASP, Joshua Ryan.
Hello, everyone. It's an absolute delight to be here, and generally I thought they'd all be following me out, so excuse me if I dip into my pockets to retrieve my notes. Oh, here they come. It's my wonderful panel, ladies and gentlemen. Take a seat. So, as Kamal so kindly said, my name is Joshua Ryan. I am the head of the Thriving Communities Programme at NASP. And what the Thriving Communities Programme aims to do is to support grassroots social delivery on the ground, where it really matters, where we're doing the most incredible work and helping lives on a daily basis. It's a genuine honour and a privilege to be able to lead that programme and see every day the difference it makes in communities. And I've heard you were just all out dancing in the foyer, so I hope you're suitably mixed and moved, because that's the sort of thing we can do to unleash the power of communities. And that's what we're going to speak about today. I'm delighted to be joined by Amy Vaughan from Arts Council England, lovely Linda Monkton from Historic England, Helen Shern from a project we have in Kirkham, and Stuart Cox from St Margaret's House in London. Stuart's got some fans in the room. Very nice, sir. So what we're going to do today is we're going to talk about how our respective organisations and projects work within communities to improve lives, to really build supportive and impactful communities. And I'm going to hand over to Amy to begin with that. So arts and wellbeing is obviously a huge part of building a wonderful community. Would you like to tell us more about how that might happen?
I would love to tell you more about how that might happen. Hello, everybody. At the Arts Council, a lot of what we do is pretty bureaucratic. We have to sit behind our desks and we deliver our funding agreements and we make decisions, and our days often go by just doing that stuff. And the time that it's brought to life and the time that you get to connect with the communities that are benefiting from the funding is the times when you go, that's why we do the job. That is the reason why you go to work and do these jobs. And I just, because the Arts Council, it is, it's a funding agency, and we give out national lottery money and government money. I just wanted to share with you our strategy, which might sound awfully dull, but it's a lovely, lovely film, and it's only 90 seconds long. But I just thought it would set the context for those of you that aren't necessarily familiar with what we do. It's definitely not that one. That's definitely not our strategy film, but whenever you're ready, I think it's on.
I think we may have had an unfortunate technical hitch here.
There it is. Create a country united by culture to be happier, healthier, excited, inspired, to make sense of our world, sense of ourselves, comforting the lonely, helping kids become grown-ups and grown-ups become kids again. Bringing us all together with the freedom to ask difficult questions and take a stand, to make your mark and make a difference, where your age, your colour and your bank balance don't matter, where it's about who you are, not where you're from, about what you do, not what you can't. For the change the worlders and the just for funners, the kids with ambition and the ambitious with kids. In villages, towns and cities, in playgrounds and packed concert halls, in rooms above pubs and festivals in fields, playing to crowds of thousands and audiences of one. Now, let's create.
So that's Let's Create, that's our strategy, and it's a pretty simple message really. It is about creativity. It's about creativity being at the heart of people's lives, being part of their well-being, being part of their community, and being part of the country that we all live in. And the reason I wanted to share that is because it's a new strategy for the Arts Council. We put it out in 2020, and then there was this pandemic, and actually, whilst at the beginning we thought, oh my goodness, this is going to really hinder getting this strategy delivered and getting things started, actually it's been a real clarifier that it's the right strategy at the right time, and it's exactly what we should be doing. And I'm sure many of you will recognise within that film there is all sorts of things in there that really resonate with social prescribing and working in communities, because actually we can't achieve all the stuff we want to achieve in our strategy unless the way that we're working and the projects that we're funding and the people that we're connecting with are feeling that stuff and feeling what it is that we want to do. So there's three parts to our strategy. There is people having creative lives, so individuals living a creative life. There is communities being cultural and exciting and creative. And then there is the whole country as a whole being creative and being recognised globally as a great cultural country. And so it's the communities bit that I just wanted to share a bit of, I guess, kind of personal experience of working in communities in the context that I work with them, because as I say, I spend an awful lot of time behind a desk. But for 8 years, I've been part of a team. The Arts Council's divided out into area teams, and I've been part of the South East team who work across the east of England and the South East of England. So we've kind of donutted around London. And about 7 years ago, I can still remember this meeting we had really, really vividly, where we were like, how can we possibly, as an agency, be working in museums, in libraries, in theatres, in galleries? Where's the unifying language for all these different types of disciplines and art forms that we're trying to support? And we just all looked at each other and we just said, we need to work in places. We need to go to places and connect with those places and see what it is they've got there, what it is they want there, and then start to build from that point upwards. And from that was born this, it's a terrible phrase, and we were just talking backstage that we create language all the time, but a place-based approach was born, and we have talked about our place-based approach ever since, and actually this strategy now really embodies that, and it's fantastic because it means it's something that we will do nationally and consistently. We were all doing it anyway, but in slightly different ways, and now we're going to have some real joined up thinking around that, which is great. But by going into places, it kind of activated us in a different way, and I was very lucky to be told that I could go and work in Great Yarmouth, and I love seaside towns. I'm such a softie for a seaside town and an end of a pier show. I just love all of that stuff. So I was delighted to go to Great Yarmouth. I was like, yeah, absolutely, I'm really happy. So with a little team of us off to Great Yarmouth, talking to the people that were there and actually being there and listening to people and finding out, we don't have the resources and the capacity to have 10 people working in Great Yarmouth constantly every day. But what we did have was people that could try and just connect some folk up and find out what was going on and say, what could we do for you? How can we convene something in a way that is really meaningful and makes something happen here? And And the reason I use the Great Yarmouth example is that I'd stopped working with the East team in December, but I was falling asleep listening to the radio the other night, and they were on the Radio 4 front row. They did a whole thing on the arts in Great Yarmouth. And and there was all these people that I'd been working with for years, chatting away about, oh, and I run the watercolour class down on the seafront, and in the holiday season, there's loads of people. And like, they were so enthusiastic about it. Didn't mention their funders once. It's like, come on, folks, we've trained for this moment. Seriously. I thought, we'll forgive you, but the local authority will be very upset. But, you know, joking aside, they were interviewing the people that we'd been working with for years who were community artists, who were people that were working and had been working in their community for years. And they were being recognised as part of the cultural scene. And it wasn't just that, oh yeah, well, we've got a theatre and a gallery, and we've built a lovely new gallery and lots of tourists come to see it and all of that sort of stuff. It was, we run the community art classes. I'm a graffiti artist and I work with kids in the local school. It was like the really tangible stuff actually makes a difference to a lot of people's lives. And so I think from my perspective, this idea about how you unleash the power in communities from a funder's perspective, from a development agency perspective, has got to be, what are the really smart interventions that we can make with our, you know, we have a kind of convening function, which I think is really useful and we should use as an opportunity, because often we can go somewhere and say, oh, we were going to have a round table. Who wants to come along and be part of this? You know, and then the word spreads and people are like, can I come? Can I come? Can I come? And as long as you say yes, then I think you're being a good development agency. If you say no, then you're being terrible. So I think that kind of working in that way has been a real lesson for the Arts Council, and it's really genuinely changed the way we work. And I was reflecting being here today, like we've all been locked at home. We have not gone back into our offices yet. You know, there's some people using offices, but as an agency, we're all still at home. And coming here and you go, oh, people, yes, I remember this. I remember these conversations and how ideas get sparked, and just remembering why we're here. And that's why I wanted to play that video again. It was like, let's just remember what it is we're trying to do, because what happens when we work collaboratively with our partners in these places and we actually focus on a common language, it's absolutely transformational. And I think our Creative People and Places programme, which is a 10-year action research programme, which really genuinely starts with the community. It's absolutely grassroots. Nothing happens unless it's come from the community. I want to pull out of the air how many Creative People and Places projects there are, but Dulcie? I think 34. And they're in places that have been identified by DCMS's Active Lives survey as where the population has the lowest engagement in culture and what you'd recognise as culture. But, you know, what is culture? Question. But those projects have really influenced our strategy. They've been going for 10 years now, the earliest ones. And again, they've been transformational for the communities that they're based in. And what's really great, and I'll shut up in a minute, but what's really great about those projects is people look over the fence and go, hang on, what? That looks good. You're getting those results. That's amazing. We want to do that. And to round that off, Lowestoft, which is but 5 miles down the road from Great Yarmouth, are going great guns on working around culture and creativity, because they've seen what it's done. They've seen the results of it, and now they want to do it too. So there's something here, I think, about, you know, sharing best practice, sharing what's working, and being passionate about it and advocating for it. People do turn around and go, oh, I think we might have a go at that as well. And I think that's what Thriving Communities is doing as well. I think that is, you know, people are looking and going, this is a really, really exciting thing, and it's having genuine results. So how do we work together collaboratively to take the learnings from that and push that forward? And I think that's all I'll say on communities.
Oh, thank you.
That's okay.
Fantastic. Thank you very much. And I think it can't be overstated how much of an impact creativity has on health and well-being and building communities in place. And I think the work you're doing at Arts Council is fantastic. As one of our value delivery partners, I just want to say thank you. I also think it would be remiss of me to say that the relationship between NASP and the Arts Council has been built from scratch with the help of a chap called John McMahon. Unfortunately, it's John's last day today, so I think it would be wrong of us not to give John just a little thank you. Sorry, John. One of our other fantastic delivery partners in the Thriving Communities programme are Historic England, and I'm delighted to be joined today by Linda Monkton. Unfortunately, Desi Gradianov was unable to make it, and if she is watching at home, please get well soon, Desi. But I'm going to hand over to Linda now, who can tell us a little bit about the work that's going on in her sector.
Thank you. Well, I was going to start by saying that I think in a way I do feel genuinely grateful about the relationship that we have with the National Academy of Social Prescribing, because it resonated with what one of the speakers said earlier today, which is that really good partnerships are based on where you match up your shared objectives. So if you looked at us from the outside, we're doing completely different things, but because my brain works in Venn diagrams, it's a perfect Venn diagram of all those bits in the middle that we want to do together about working with people. Now, Historic England is an organisation which aims to champion and protect the historic environment. So we deal with stuff. It can be round or pointy, it can be under the ground or above the ground, but basically it can be a big landscape. But we deal with looking at that stuff and saying why it's interesting and trying to protect it. But we do that through our future strategy by the reason that we do that, as articulated through our future strategy, is to improve people's lives. And it's very easy to say, and I like Amy, you know, as a strategist, you kind of come up with these grand terms. But as head of wellbeing and inclusion strategy, part of my job is to say, well, what does that look like? What do we actually mean by that when we're talking about wellbeing and health? And how can we deliver it? And I think our partnership with NASP has really helped us understand how we can deliver it tangibly in a way that it meets need. Because one of the things that's really easy to do is to, as a strategic organisation, is to work in a local place, you know, helicopter in, work in a local place and go, ooh, it's really interesting. Engage the self-selecting people that come along to your lovely town hall meeting or your engagement activity and go, oh, I'm sure they felt better at the end of it, oh, we special. But actually what we want to do is to work with intent, is to actually go, what is that local need? And for a strategic body, that's quite hard. We're not on the ground all of the time. And the only way to deliver that is with other people, is with people who are on the ground all of the time. So we do various things within the kind of wellbeing and heritage team, which is me and Desi, so huge team that we are. And some of that work is about research. What is the relationship between wellbeing and heritage? Like, what does it actually look like? What makes a difference and how? And some of it is about, you know, innovative pilots, and some of it is about, you know, working with others and supporting the Thriving Communities programme to go, what works. And there isn't time to go into all of the things we do in that area, but by chance, just a few days ago, we did launch our latest edition of our research publication that summarises all of our latest research, which by chance is dedicated to wellbeing and heritage. Yay. So if you Google, and other search engines are available, the words Historic England and latest research, it should pop up by magic. And that will at least give you an overview of some of the research projects that we're doing and some of the projects and case studies that we've been involved in. And Helen in a minute is going to talk about one of those. So as well as all of that work, we do, as indeed reflecting what Amy said, we do place-based work, and we have regional teams that go out and work in combination with local authorities to say this place needs revitalising. You know, the historic buildings are run down and the high street isn't functioning, and we invest money and resources with that local authority to try to kind of build a slightly better quality of place. And one of the programmes that we're doing at the moment, which is called High Street Heritage Action Zones, is in Kirkham in Lancashire. And I have to say that the reason that we're involved in Kirkham, we're involved as an organisation in Kirkham. We funded them to do their high street has, as we call them. But the reason that I'm involved in Kirkham is because the lead in the local authority, Andrew Chatterjee, I think single-handedly has said, this cannot work unless we embed wellbeing in it from the beginning. And he approached me, and we've been working together to commission Helen to do all the hard work, really, basically, which is to work out what does that look like on the ground? How could we embed social prescribing in a thing that started off as we must revitalise our high street? And what is the community and cultural connections between those that can enable some kind of social prescribing delivery? So that's why Helen is here, really, to articulate all the really difficult, complicated stuff that she's been doing. And what I really hope, and I hope I can speak on behalf of Helen and Angie here, is that this will be a kind of flagship project for us, that as we move forward and do more and more place-based work, we can look at how do we embed wellbeing with intent from the beginning, and how can we use social prescribing to help us deliver that to a particular local need. So I think I'll shut up there, actually, and hand over to Helen to talk about the nitty-gritty.
Thank you, Linda, and hard work of a lot of people, actually, and also the research journal that you mentioned. I've got a slide for it, so there's a web link there. So thank you, and I'm delighted to be here to share the Heritage Health and Wellbeing Programme that we've been working on in the historic market town of Kirkham in Fylde in Lancashire, northwest England. So I'm a consultant in arts, heritage, health and wellbeing with over 20 years experience in the NHS, and I'm an occupational therapist as well. This programme is part of a larger regeneration 4-year programme, as Linda mentioned, and part of the historic High Street Heritage Action Zone in partnership with Fylde Borough Council, managed by Andrew Chatterjee. The town also received Future High Street funding. So last March, myself and colleague Ferry Van Dyke of FDVD Consulting were commissioned to undertake a feasibility study to assess local demand, population health, the current social prescribing offer and infrastructure, mapping assets and researching the potential for an appropriate social prescribing delivery scheme using heritage-based activities. We received brilliant support and advice from colleagues such as at Lancashire County Council and the NHS and others. We designed and planned a Heritage Health and Wellbeing programme incorporating social prescribing, and I've been coordinating its first year implementation, which started last autumn, and Ferry has been undertaking community consultation and in-depth research on heritage trails. Next slide, please. Next slide. Yeah, that's it. This is the research journal that Linda mentioned, and we were really delighted that the front cover is the amazing cotton dance heritage performance that we commissioned in October, and the market square that you might recognise from the original photograph at the beginning. So this is by About Time Dance Company, who do heritage-based dance pieces, and it's based on the lives of women working in the cotton mills, and we also had schoolgirls from the local school, Car Hill School, performing, which was wonderful. In the article that Andrew and myself wrote, which was published last month, as Linda said, we talked about sort of Kirkham forging a heritage programme as a bridge to wellbeing. So, and I like to refer to it as a sort of bridging aspect because of the sort of aspects around restoring and supporting assets, mapping and navigating, making foundations and alignments. And just to mention as well that Lancashire has got a huge heritage around textile production, and was actually, Kirkham was called the Cotton Town with its flax mills, which have now gone. Next slide, please. So in the feasibility study, we looked at improving personal and community wellbeing using the architecture of social prescribing. We referenced the conceptual framework, community spirit level by the Royal Society for Public Health, here in the diagram on the left, with its 4 elements to improve community wellbeing, good relationships, collective action, and by harnessing community assets, a sense of belonging, cohesiveness and inclusion. From consultation with those stakeholders and cross-referencing local regional heritage case studies and research, we proposed 4 overarching heritage themes and activities for the programme here on the right. So we have sustainable textiles, life stories and memories, healthy living and food, heritage skills and craft. We showed how the programme could contribute to the NHS long-term plan with its whole systems approach, working better together, making better use of resources, assets and supporting health priorities. We referenced the literature on social prescribing, referral routes and link workers. And we have evaluation by independent researchers to understand the impact of the pilot programme, and the Kirkham Futures website where the overall programme is there. Next slide, please. So here we have the map of the particular primary care network that we're working with, and the green area is the REN primary care network, or Wire Rural Extended Network, and Kirkham is kind of on the bottom of that green area, quite close to the blue patch. So we're really excited about this innovative proposal that we're still working up and needs to be signed off. So this is with the REN primary care network and the two GP practices in Kirkham, Ash Tree House and Surgery, and Kirkham Health Centre. So the proposal is for a local heritage health and wellbeing coach, jointly funded, so using that, the additional roles funding, and that post holder would be based with those two GP practices and working with the rest of our programme, the social prescribing programme and the link workers that are attached already. So Andrew Chatterjee, Lindsay Beniston, the REN business manager, and myself have been having detailed strategic meetings to design and align this new special post in collaboration with NHS England, Lancashire and South Cumbria Primary Care Training Hub, the CCG and the ICS, and Historic England and filed. So we've got quite a lot of partners just to kind of sign it all off, but we're hopefully almost there, and we would then be advertising and recruiting for this really kind of special role, really innovative, and evaluate it as well, and this would be for 2 years. Next slide, please. So the other essential keystone in our bridge building was the commissioning of a pilot social prescribing programme called Phoenix Rising, using heritage-based activities. So Phoenix Rising were already delivering across Central and North Lancashire and South Cumbria with the Thriving Communities Fund. So it was absolutely fantastic that they could actually come and work in Kirkham really quickly, kind of work for us for a pilot. And Phoenix Rising is made up of Green Close, the Gathering Fields Eco Retreat, Lancashire Wildlife Trust and Mandela CIC. So we thought it'd be really beneficial to learn from what they've been doing already during the lockdown of last year, the sort of marketing and the relationships. So they provided tasters in November and December, and then regular weekly sessions from January in these range of things to do with sort of combining movement, art, nature, and we're going to have textiles and herb gardening in the library soon. Well, actually, it's already started, actually. So they've been doing a great amount of marketing, both social media and printed posters in shops and all sorts of things, and lots of self-referrals. And this is being evaluated with bespoke surveys and focus groups and a report in June. And also what was really brilliant was that Phoenix Rising already have a partnership with the Lancashire and South Cumbria Recovery College. So I know that from my experience working with Recovery College in South London and Maudsley NHS Trust, that is a really good way of working together, providing educational sessions. So next slide, please. So combined activities involving art, nature and movement that will draw on the distinct heritage themes of Kirkham. And this phrase, culture therapy, was referenced by the Restoration Trust in the Creatively Minded and Heritage Report of 2021. And here's some photos. So there's St Michael's Church, which has been a venue for some of the sessions, the cooking together, the cooking, and I'll talk about St Michael's Church in a moment. Next slide, please. So what was really wonderful is that already there was Kirkham Treasures, which is a culture programme that started last year, also funded by Historic England. So they've been doing a lot of groundwork, a lot of co-production, events, talking to people, all sorts of installations and a trail, and just recently Kirkham with Love, storytelling and capturing love stories and things like that. So they put together this map with Kirkham Grammar School, and I think it really highlights the kind of wonderful things that could be discovered. That I mean, Kirkham's got a huge history with Roman remains of a fort. There's a Roman boss shield that was discovered in Carhill, and the original is in the British Museum. And also what's exceptional is the history of Kirkham Club Days. which are kind of, there's a few of them in the Fylde area, and Kirkham actually means church town, and there's a lot of churches in Kirkham, and they all come together to do this incredible procession with brass bands and beautiful kind of community involvement. And obviously they've not been able to for the last 2 years, but they hope to in June. And it's a really important part of Kirkham and Wesham. So we think it's really important to discover and look after these treasures in Kirkham, the histories, the memories, the stories, the assets, to support the individual and community wellbeing. Next slide, please. So almost the final slide. So this is what we're proposing to do next stage, really, and it's all to do with layering up and co-production and kind of building on those wonderful things that we've discovered that are there in Kirkham. So we've been commissioning some new projects that are built on that. So we were really pleased to be able to view the local history collection of Martin Ramsbottom, who's known as an authority on Kirkham, and bequeathed his collection of local history documents and papers and all sorts to St Michael's Church. And so they are actually launching a new Heritage and History Centre there, and Adrian Long is supporting it. We also received expert advice from Lancashire Archives and Museum Service on digitising, conserving, exhibiting the archives, etc. So that was wonderful. And Phoenix Rising will co-produce a heritage trail, an object handling box on textiles with a new community heritage group and artists, building on from what they've been delivering already, and some of those members are really keen to take part. So genuinely co-production there. And Helen Just and Kirkham Treasures, as mentioned, will be commissioned to collect more oral histories and produce other events. So we're kind of dovetailing the work that they're doing and make it more accessible, so we can look towards other kinds of wellbeing activities with these heritage-based activities. And Sewing Rooms will put on their Age of Inspiration social and wellbeing event for isolated older adults, and that will be supported by Carhill School, their Duke of Edinburgh scheme. There's also a planned wonderful Heritage and Eco Skills Centre at a building called Hillside that's empty at the moment, and an arts and community cinema. So hopefully we'll be able to build in a programme there, and I know that the Wren PCN and Lancashire South Cumbrian NHS Recovery College are really interested in that as well. So we'll continue with the evaluation, consultation, we've got a consortium as well that we'll sustain, and look for further opportunities for those pathways for training, volunteering, networking with the architecture of social prescribing. Essentially continue to support the 4 elements to improve community wellbeing and individual wellbeing. And last slide. And so, last slide, please. Thank you. So privileged. So I'm really privileged to have been working on this programme in Kirkham and to present here. Here are my details if you'd like further information, and thank you.
Thank you very much, Helen. The breadth of the work you're doing in Kirkham absolutely astonishes me, and I just think it speaks to how important these partnerships across sector are, because we can bring in so much expertise and so much passion into the work that's happening in communities. And someone else who has an incredible diversity of work that's happening within his organisation, St Margaret's House, is Stuart Cox, who is going to tell us a little bit more about how you're working in London.
Yeah, hello everyone. My name's Stuart. I'm the Arts and Wellbeing Director and Deputy CEO at St Margaret's House. We're an arts and wellbeing hub, and we're based in Bethnal Green, and we've been in Tower Hamlets, and we've been really lucky to have been one of the 36 Thriving Communities projects across England. And I suppose I'm just going to give you a little bit about that journey and how it's kind of what impact and kind of, you know, the effect it's had on us. Actually, it's been an absolutely overwhelming project and absolutely brilliant. And I've been reflecting a lot, because it's you know, nearly a year down the line, and it has felt like putting on a workshop of a big new musical. That's the only way I can kind of describe the kind of element, exactly. But that idea that there is, when you put something like that on, there are so many different elements. You have, a choreographer's point of view, you have a director's point of view, actor's point of view, musical director point of view, a set designer's point of view. That has kind of been the same with this project, where there's been so many partnerships, relationships to be built, and to build something cohesive and build a project that works across our community and come together and trial something completely new. So from that aspect, it's been really, really exciting, and it's been a really, really exciting year. Our project is called the Health Tree, and it has two major elements, really. One of which is the delivery of activities where we're working in partnership with lots of lovely organisations, and that includes Spare Tire Theatre, Fevered Sleep, Outside Edge, a health organisation that addresses health inequalities in the East End called Social Action for Health, and a more strategic partner, London Arts and Health, who I have to champion a lot, because I don't think that we'd have been able to get the funding without their help and without their stewardship. So we've been having a wealth of activities delivered, which has included COVID cafes for people recovering from COVID. We have had acupuncture, woodwork. I believe there was a film showed of our woodwork project this morning, dance workshops, fitness. They've happened all across the borough. And another element of the project has been a kind of more strategic element, which has been about opening up a conversation about what social prescribing is, and how that can be raised, how the awareness can be raised amongst everybody in our community, and having opportunities to ask the question, what is social prescribing? How does it work? What is the relationship between activities, service providers, and link workers, or social prescribers, or GPs? And what we found is that there was a lot of people who wanted to find out more. So we've had a kind of networking element. We've had regular meetings and opportunities for anyone interested to kind of ask and talk to social prescribers. It's been really interesting that for us, the fascinating thing is actually what, as arts providers or cultural providers or local providers, is we've been fascinated by the conversation that goes on between a social prescriber and a patient, and wanted to find out how that worked, and kind of that was a real mystery, and having the opportunity to ask those questions has been brilliant. And alongside that, there's also been live kind of events to kind of celebrate social prescribing in an area, and that's where we had an amazing one in October, of which Joshua, you came to, and John came to, and was amazing for the community to come together. I know we was asked to kind of reflect on kind of what we've kind of learned, or what the community has gained, and I was kind of thinking about that a lot, and I sort of feel like one of the things that's happened for us is the idea of a kind of awareness raising that health, well-being, and arts can be delivered in a multitude of places that maybe you wouldn't, expect. In the case of our project, it's delivered in a church. It's activities are delivered in a shop. They're delivered in a hall. They're delivered digitally. We have a massage, Charlotte, that's a kind of group one in a kind of hall, a kind of, our woodwork is in the shop. And that has been a really kind of awakening in the community. For us as an organization, a year and a half ago, I probably couldn't have told you anything much about social prescribing. It's been a real learning experience, but we had a sense of it going on within our organization, but couldn't quite grasp it. And this project has really been able to help us get much more of an understanding and grasp, how it works. And we now know that, like in our project, where we had a feeling that there was like 4 or 5 people benefiting from our services that are socially prescribed, we now then know that's gone up significantly, which is brilliant. We kind of knew who our kind of social prescriber was around the corner. This project has enabled us to develop a relationship with 16 social prescribers across the borough, which for us is amazing. And the other thing, I think, leading on from that we've kind of gained, or there's been a shift, is I think there's just been an openness. This project has opened up an openness with everybody from community, service providers, link workers, Tower Hamlets GP Care Service, who is our social prescribing service, who have been amazing. to have conversations and I suppose go above and beyond the systems that are in place. I know that, like, for example, there's a traditional, if you want to kind of, the clarity the system is called in Tower Hamlets, where you put your activity on. But actually, what this project has done is bring us all together to have conversations and absolutely raise awareness of each other and trial things new and do things differently. And I think the best evidence of that is coming up to our next public event, which is on March the 10th, celebrating Social Prescribing Day. Everyone is being involved, everyone is doing something, and our Tower Hamlets, social prescribers, are going to be putting on a brief play to describe that conversation I was talking about that we all want to know more about, which I think is brilliant. And that whole idea about different organizations working together, one of the things that's been really impressive about Social Action for Health, who are kind of, I would say, the health organization in our partnership, is actually, and they say, oh, we love working with the arts. It's an absolutely different approach. Your meetings are so much more interesting for a start. But I'm like, but actually look at the way you're delivering your activity. You're doing a dance project, and within it, you're embedding IT skills and language and culture skills. And that has been brilliant, that whole learning from each other. And I suppose the other thing that's been amazing for us is the relationship with organizations like NASP, London Arts and Health, which has led us on to be able to meet and talk with the culture team at the GLA and Claire Lovett, who was, I think, here, and to be in the room having conversations and to be talking about where we go next with this and be able to kind of share that has been amazing. So for us, it has been an absolute whirlwind of a project. I go back to that analogy of this idea of a workshop. And I would say that now this has started for us, we can't go back. So we have to figure out how we move forward and how we work together to take this amazing kind of like learning that we've done forward. So that has been our experience. And yeah, thank you very much.
Thank you. Thanks very much. Thank you, Stuart. And I will say that live event that St. Margaret's House put on was the first live event I'd been to after 3 lockdowns living on my own, and I genuinely cried. To see that sense of community and those relationships building in a room in front of your eyes in 3D for the first time in like 2 years was just immensely powerful. And I use the words relationship there because I hope the panel would agree with me that all of this is about building relationships. It's about building relationships across sectors. It's about building relationships within communities. It's about opening up whole new worlds to people who are experiencing a lot of this for the first time. And the Thriving Communities programme, its very heart is about supporting those communities and making sure that people are ready to receive social prescriptions, are engaged, involved, building networks, knowing who to lean on for support. And when we say who to lean on for support, the very heart of the Thriving Communities programme is our incredible regional leads, who I all see sat there in a row. So if I can't overstate the amount of work that they do within their regions to support this sector, so I want to give them a round of applause as well, please. Clapping yourself there, Esther, very good. Because I am a dreadful chair, I'm afraid we have run out of time and do not have time for questions. However, I will be floating around in the foyer, as I'm sure my wonderful panel will be here. So if there's anything anyone wants to know, please do come up to me, say hi. I'd like to thank my panel again. It's been incredible to hear your stories. And I'd thank all of you for sticking with this throughout the entire day and still remaining at the last panel of the day. I guess that's me. Thank you so much. I hope you've all had a really wonderful day, and I hope we all get to see you in person again very soon. Cheers.
Thank you very much. Our final panel of the day, ladies and gentlemen. Oh, what a day, what a day. We've learned, we've listened, we've written, we've danced, we've cried. It's been beautiful. It's been beautiful. First and foremost, I want to say a massive thank you to all of the speakers, the panelists, the chairs that we've had today that really made this event what it is. So a round of applause for all of them, please. Thank you. Beautiful. A round of applause for you. You've been amazing. You've been beautiful. Seriously. And thank you to everybody online, in the online world. Thanks for sticking with us. You get a round of applause as well. And of course, the main production team and the captioners at the back. Congratulations on sticking with it without the hands cramping up. You're heroes, heroes. And thanks to the production team, been amazing. And thank you to NAS for putting this event on. From here, by show of hands, how do you feel like you have learned something that you're going to implement moving forwards? Amazing. Show of hands, how many of you feel like you have a bigger sense of mission now? Yeah, seriously, it's been contagious today. Hands up if you think salty popcorn is better than sweet. Wrong, incorrect, completely incorrect. You were doing so well. Obviously, today is coming to an end, but it's the beginning of Social Prescribing Week. So please continue for the rest of this week to keep on sharing, keep on letting the world know what social prescribing is about. And of course, the event on the 10th of March. Make sure, if you can make it, to go and support. I will be checking Twitter to make sure you've been tweeting all day. So if you haven't, feel free to, like when you've got homework due and you forgot, and you've got the lesson next, feel free to do some rush tweeting at the end here. It's absolutely fine. And of course, personally, this has been like a full circle day for me because it was a year ago, last January, I had a conversation with Dr. Rada, who introduced me to the NASP team, and they said, we'd like to figure out how we can creatively explain, just summarize what social prescribing is about. And I got commissioned to write a spoken word piece about social prescription. So thanks. So before we release you back into the wild, just share the piece with you before we go. And it went something like, look, we all want to be healthy and happy. That's not an impossible idea, a lie, or a dream. And it may seem like quite an obvious thing to say, whilst we sit wondering whether society would allow us to say we were any other way. You know that pressure of appearance. Are we allowed to say when we're not okay? Because all too often, physical or mental health difficulties get in the way. Whether that's events beyond our control, personal circumstances, or genetics at play. Because if 1 in 5 GP appointments are for non-medical problems, then this could be a time to explore other possibilities and options, like social prescription. A system that takes a different approach, where we don't just deal with the symptom, but sit with you to trace it, understand the cause, and help create a plan to replace it. Talking about your health, finances, housing, or stress, before linking you to activities that will empower and suit you best. What if you were prescribed a social engagement, a social arrangement, to get a pep in your step and your feet on the pavement, a brush in your hand, a tune from your lungs, a talk and support to help you manage your funds? I'm talking about a place to feel connected with the community you've selected, making your activities more effective, experiencing as a collective, so you are positively affected whilst feeling safe and protected. Surrounded by new people, allowing you to feel part of something bigger than you. We all want to be healthy and happy. And it's not just a nice idea, but a system that works, that asks if medicine isn't the only option and puts you first. With a wide range of solutions to help you get through, a social prescription could help you too. Thank you very much for your time, ladies and gents. It's been beautiful. Please join us in the foyer afterwards. We have a performance from tomorrow's Warriors, and there will be refreshments until 5 o'clock. We're going late tonight. So, thank you so much. It's been wonderful, and we'll see you in the foyer. Peace.